fear, anxious or anxiety-related behavioral disturbances such as phobias and panic attacks. Depression, which is persistent and pervasive sadness, low mood, and excessive fatigue and loss of interest. Sleep-related disturbances are those that include insufficient sleep, difficulty falling asleep, or misalignment of sleep-wake patterns. Alcohol misuse here includes drinking despite impaired function, harming oneself, and alcohol dependence. Eating disorders are disturbances of eating and may include behavioral restriction of eating, compulsive exercise, binging, or purging. The International Olympic Committee released a mental health consensus statement which further identifies the following mental health symptoms and disorders in elite athletes: post-traumatic stress disorder, attention deficit hyperactivity disorder, bipolar and other psychotic disorders, suicide, gambling disorder, as well as substance use and misuse. The prevalence of mental health symptoms and disorders according to the consensus statement. Anxiety and depression, here the IOC found that 33.6% of all elite athletes and 26.4% of former athletes reported symptoms of anxiety and depression. A whopping 49% of said athletes reported having sleep problems and are described as poor sleepers. ADHD was found to be in 5.4% of athletes. Suicide, so a large study of suicide in the US in elite collegiate athletes, excuse me. Right, so, right, there we go. So 7.3% of college athletes were noted to have suicide attributes. This is lower than when compared to the regular population, but it is believed, or it is found, that 1 in 6 international athletes reported having some experience in suicidal ideations. In eating disorders, the estimated prevalence of eating disorders or disordered eating among athletes in general ranges between 0 to 19% in men and 6 to 45% in women. These figures are much higher in non-athletes. In Paralympics, Paralympic competitors may have unique mental health challenges, but specific research is quite limited. Rates of mental health symptoms and disorders, specifically depression among the general population of people with disabilities, are reported to be higher than in non-disabled individuals. Nonetheless, a review of 12 studies of Olympic and Paralympic athletes demonstrated that most indices of well-being, which includes confidence, self-worth, and acceptance, were similar in both groups. Emerging research, however, suggests that athletes making a Paralympic team may have lower rates of depression than those who tried out for the team and didn't make it. While eating disorders in Paralympic athletes have received little research and attention, those that restrict their food intake may suffer a greater risk of complication from low energy availability as well as low bone mineral density. Athletes with disability experience both sport and disability-specific stressors that may contribute to mental health symptoms and disorders. These may include chronic pain, overtraining and injury, lack of adaptive sporting facilities, sleep condition, as well as negative coaching behaviors. And now let's look at stressors of mental health. These stressors in mental health can be split into 3 major categories as seen here. Competitive stressors are those environmental demands that are associated primarily and directly with competitive performance. These are the preparation, injury, pressure, as well as rivalry and major competition. Personal stressors are those environmental demands associated with the personal or non-sporting part of things. Work-life interfaces, family issues, or death of somebody close to you. Organizational stressors are those associated primarily and directly with the organization within which an individual is operating. So, the leadership and personal issues, the cultural team issues, and the performance as well as personal issues. Another important category of stressors not focused here on the screen are those that are traumatic. These can be inside as well as outside the sporting arena. They may include bullying or cyberbullying, physical, psychological abuse, as well as sexual harassment. On an important note, the ways in which an athlete appraise and cope with these stressors can be a powerful determinant of the impact the stressor has on both their mental health as well as their sporting success. As members of athletes' entourage, so this includes us as professionals, coaching staff, medical staff, as well as the family, it is important to recognize the impact that such stressors can have on the athlete and work with them to develop healthy coping strategies. Reiterate, it is absolutely important to improve our understanding and awareness of mental health symptoms and disorders in athletes, to recognize the signs and create a culture a culture that supports help seeking. It is also important to invest in educating staff members and facilitate regular screening for mental health conditions. These were the references used, and thank you for listening.
Thank you so much for your informative presentation, Ms. Grant. So at this time, we are going to be having a Q&A session. So if you have a question, you can type it in the chat, or you can raise your hand, and I'll address you and you can go ahead. Okay, I see a hand raised from Olivia Rose. Go ahead.
Hi, good evening, everyone. Very good presentation, Mr. Grant. I just want to know, you mentioned something earlier about it is important to create a culture of help seeking. Can you kindly elaborate how you go about this given our context?
Here we want to remove the stigma placed on mental health, and how we look at mental health with people in general. Athletes sometimes go through stress or are introduced to stressors that can affect them negatively, but because of how society itself looks at mental health, they're afraid to speak up and out about the issue. So education plays an important role here. So educating both athlete and support staff, the athlete entourage, will help to decrease this stigma attached to mental health, to better allow the athlete to open up about some of these things.
Thank you, Tony. Dr. Hansen.
Very good presentation, Tony. I just wondered, in searching through the volumes of research done on mental health in Jamaican athletes, what were your findings in terms of statistics?
Based on the information presented, the IOC consensus statement really focused on those athletes in Europe and the US. There is not much research done as it relates to mental health in the Caribbean and other territories. So it is hard to give a qualitative number or comment on mental health in Jamaican athletes, as you asked.
And that's the point. That's the point I wanted to make. That I don't know how seriously we are taking the issue in our setting, in spite of all the evidence there to show that our young people have some serious mental health issues.
And that is true. We have all, as professionals, worked amongst athletes, whether elite or domestic athletes, and we see these stressors. We see the signs, we see the symptoms. Yes, we are not able to clinically diagnose them, but we see it, and it is important, as I said earlier, to remove the stigma from mental health. And it would be good, yes, for us to dive into some research locally or in Jamaica pertaining to mental health in our athletes.
Okay. All right. So we have Terry Ann Brown in the chat. She's asking if the lack of evidence, if you feel like the lack of evidence and research is because mental health isn't prioritized here in Jamaica and the Caribbean. Tony, what do you think?
Yes, it can be as a result of such, but
Yeah.
then again, it plays right back into the stigma we attach to mental health and these symptoms and conditions faced by people in general. It's not just athletes.
Yeah. Yep. All right. So we have Rory Alvaranga, adding to the discussion, asking, how do you think we can get rid of this stigma? She has invited athletes and parents, however, only one is here after they've read the flyer. So he's asking, how do you think we can get rid of the stigma?
Public education is a major part, and I think this is our start to educate people about mental health and how it really affects our athletes, and teach them that it's not something bad, it's not something we look down on, it's not something we laugh at, it's something that's serious, and we need to take steps into decreasing the stigma and move forward to help these individuals, because it does affect them physically, and we do see that their performance levels and their attitudes drop as a result.
Okay, John Campbell, go ahead.
Right. Thanks again. Many thanks to for the presentation. The two previous respondents actually touched on something that I wanted to say. But I guess in a nutshell is, the question is, what should we be doing further, to promote the value of mental health? Whose lap does this fall on? Is it the Sports Medicine Association? Is it the broader medical community? And also, at what level should this begin? Should we start this the appreciation of this at the high school, the prep school level? I just want to get feedback from anyone, certainly the speaker on this. Where should we start? So yes. Thank you.
I believe that we can start as early as the youngest athletes, right? Educating the young, as you say, high school, prep school. Once they start competition, we start to identify these things and talk to them, make them aware of what's happening, what can happen, to let them not hide away or shy away from talking to people about what they're feeling and what they're going through as athletes, no matter how young they are. Once they're competing, it can affect them, whatever age.
Okay, Coach James, go ahead.
Hi everyone, how you doing? First of all, Tony, and really great presentation, and thanks a lot to Dr. Diallo for inviting me. I can speak on this from many fronts because number one, I'm a Jamaican. I used to be an elite athlete at one point in my life, and I'm now a practicing strength and conditioning specialist here in New York, and I go to Jamaica on a regular basis. And this has been one of the topics that's been on my agenda for the past 15 years. And I can explain to you a little bit why. I am an Olympian from the track and field, and I've been observing a very dangerous trend over the past 20 years. And I've been watching just how we as Jamaicans operate and why we operate on a failed system. And I can explain to you what I mean by that. Someone once asked the question, how can we mitigate the problems in front of us with regards to mental health issues? These can be fixed simply by having a public service system where we allow our population to, first of all, identify that mental health issue is not a stigma. It is a part of what we have to go through. Actually, let me go back again. I've been watching the system of how we operate for the past 20-something years. And what I've recognized is that we operate on a 5-year cycle in terms of learning. And all of this mental health issue starts from the first 5 years of our lives. And a lot of the athletes that we have, if you notice, they're mostly coming from extreme traumatic situation, and they're using those trauma as fuel for their survival. Because when you think of every last athlete that we've had, every last athlete who have been a gold medalist or a champion, if you dig deep into their lives, you're going to figure out that they're using their sport as a form of crutch for their mental health issue, or for whatever issues they go through. And one of the biggest problems we have in our teaching system in Jamaica is the concept of everyone must do their own work. I'm saying that simply because when I look into how I teach here in the United States, I teach at a private school versus how we teach in Jamaica. Here, we encourage collaboration. We encourage the kids to ask for help, ask questions, and don't be ashamed of if you don't know. In fact, if you don't know something, that's absolutely great because you get the opportunity to learn. Now, in our education system in Jamaica, we don't teach collaboration, cooperation. We teach competition. And between that first 5 years of our lives, we're learning how to be number one, when oftentimes we don't recognize that number one is the loneliest number and it is the most vulnerable. And even coming from someone who actually shut his mouth during the Olympics, when my dad's funeral was going on, like my dad was getting buried while I was at the Olympics, I can speak firsthand on how fear, anxiety, and fear of loss can lead you to a kind of dark path. That's all I'm going to say right now.
Thank you so much, Coach James, for sharing and
Thank you, Coach. Thank you.
For sharing your first-hand experience. So we have Julia Cousins from the chat. She says, we have to get professionals involved from early, having sports psychologists more involved as part of the teams, as well as having more sessions, forums, avenues for athletes to express themselves without judgment. And then Dr. Olivia Rose says, public education isn't lacking. It's a cultural issue based on many remnants of our colonial past, with the extreme need to be seen as strong by any means necessary. And so help-seeking behavior is contradictory to that image.
Excuse me, actually, just to acknowledge that Dr. Oliver Rose, she's a sports psychologist herself.
Right. Thank you.
So she would definitely be speaking from that point of view.
Yep.
I think we can only handle maybe 2 more questions overall. What time is going?
All right. So, yeah, right. Thank you, Dr. Brown.
Yeah, so it's Priya Patterson Brown. She has her hand up. And then Dr. Hansen. Mrs. Brown?
Yeah, I'll concede to members of the audience in that I'll probably do a line or 2 before my presentation. So I'll concede to
no problem.
Visitors.
Much appreciated. No problem. All right. Dr. Hansen?
Yes, just some comments. One is that we've had discussions not just about athletes, but about young people in general in our society and mental health issues. And when we speak, even with what in recent times, what has happened in the schools when the students have returned to school and are confrontational with teachers and teachers confrontational with them. And a certain segment of the society looks on at the behavior of these kids and we see it as dysfunctional. No, I got a different perspective from traveling with a youth team a few years ago and listening to the conversations that went on between one segment that was from the inner city school system and from one of the rural schools, and another set of athletes who were from one of the better schools and one who was going to high school in the United States. Now, we would look at the behavior of the one who was from Immaculate, let me call that name, and the one who was in the States and say, boy, these are well-outfitted young ladies to take their place in society. But one night I happened to listen in on a conversation between the three from the inner city and one of our rural schools. And basically their perspective was that, boy, these girls are nice, but them just not ready for life. And the background to that was that the competition was during the school year. So the agreement was that they would get their assignments sent to them and do the assignments while we were on the trip. What I saw coming to the students from the inner city schools was the fight of the day. It was always a vicious fight between a boy and a girl, or a girl and a girl, or a boy and a boy, or a teacher and student. That was their experience of school during the day. And life is like that. You have a fight and you have to carry on bad for man respect you in a school. And that's how it is going to be when you get out in life. And unless we who know better start addressing it from their perspective, they don't recognize that their behavior is dysfunctional. And I saw it on that trip, right? They don't see it as dysfunctional while we may, and that is one of the things that we need to address. Now, the coach, who is a very eminent coach in Jamaica, said to me that he believes that the vast majority of Jamaican athletes that he has dealt with all have a psychological problem. The athlete that you deal with on one day is totally different the next day. You can't tell what you're going to get the next day. And he has proposed to the powers that be that they need to do something about this to help our athletes. And he says he has done it, he has advocated for years and has got nowhere with doing so.
Dr. Hansen,
Were you finished?
I think he lost connection.
I'm finished.
Okay, okay, thank you. Thank you for sharing. So Tony has started a very exciting discussion and it continues in the chat, but we are going to go ahead and move on. And so I am going to, please hold on to your questions. I'm sure you'll have a chance to share again. But we're gonna move on and I'm going to invite Dr. Dominique Smart, who is our second moderator.
Good afternoon, everyone. Thank you again for joining us for another Keeping Pace seminar. So the next presenter that we'll be having coming to our screens is Mrs. Piran Patterson Brown. For over 30 years, Piran has been doing what she loves and loving what she does, which is physiotherapy. She received her diploma in physiotherapy from the University Hospital of the West Indies School of Physical Therapy in 1991 and a Bachelor of Science in Physical Therapy in 2010 from the University of the West Indies, Jamaica. She holds a postgraduate certificate in geriatric care management from the University of Florida. She's an American breast care certified post-mastectomy bra fitter, a certified kinesia taping instructor since 2011, and a member of the research committee of Kinesia Taping Association International. She revels in the transformative impact of the kinesia taping method in the lives of many individuals. She recently completed the IOC diploma in sports physiotherapies in 2021 and the IOC certificate in mental health in elite sport in 2022. As founder and CEO of Therapeutic Touch, Mrs. Brown has the distinct pleasure of activating her passion daily. She has served at Spanish Town Hospital between 1993 to 95. She was the head of the PT department at Mapen Hospital between 2003 to 2004, and was also the acting head of department at the Mandeville Regional Hospital from 2011 to 2015. Mrs. Brown is a member of the Jamaica Association of Sports Medicine and the current treasurer of our chapter as well. She has served as president of the central chapter of the JASM between 2017 to 2019. She has represented as team PT for both Jamaica's national junior and senior track and field teams at several regional and international events, from the Carifta Games to the Summer Olympics. A dedicated member of the Jamaica Physical Therapy Association, where she has served as president between 2013 to 2015. When she's not busy globe-trotting and helping athletes, she enjoys reading, traveling, and gives service in her parish through the Lions Club of Clarendon, where she is also the president. She was also the president between 2021 to 2022. I'd like you to help me to welcome to your screens, Mrs. Piran Patterson Brown.
Good,
Mrs. Brown, yours.
Good afternoon, everyone. Thanks so much to the Central Chapter of our Jamaica Association of Sports Medicine for inviting me to participate in this educational webinar in helping to increase mental health literacy for our athletes, coaches, everybody in the athletes entourage, or sports medicine personnel as well. This afternoon, let me share screen. Share. Okay, start here. Good. So this afternoon, I'll be looking at mental health screening tools as per the IOC. My objectives today: to define screening, the relevance of screening for mental health symptoms and disorders. We're going to have a look at the IOC Sports Mental Health Recognition Tool and the IOC Sports Mental Health Assessment Tool 1. And then we will wrap up things with our take-home message. So, screening, as defined by WHO, is the identification of unrecognized disease in an apparently healthy or asymptomatic population by means of tests, examinations, and other procedures. We know that these instruments can be used in preventative medicine to identify very early individuals at risk to specific health challenges. We use screening tools to identify the presence of symptoms or disorders, to help avoid or decrease symptoms, and to facilitate necessary treatment and support for more positive outcomes in any given population. Good screening tools can be validated. They are usually free and easy to access, simple to administer, straightforward to interpret, and of course, they are able to identify problems or challenges early. In sports medicine, we want to ensure that we are screening pre-season or pre-participation in our pre-participation evaluation. By incorporating them, it's an easy way to detect problems and initiate support. Example, in sports, especially since COVID, we use our SCD or SCA to identify SCD or SCA risk amongst our athletes, right? Administering them following injury or adversity can also capture struggles before they develop into severe illness or impairment. Screening tools can help to assess the type and severity, of course, of the problems that we are having, and therefore we can facilitate further investigations to help establish diagnoses. Of course, screening tools also help us to guide referral and get the necessary resources that are needed as athletes or persons in the entourage seek help in managing mental health disorders. As a background, the IOC developed a mental health consensus statement in 2019. One of the main recommendations was the need to appropriately screen for mental health symptoms and disorders in our elite athletes throughout their career to ensure that affected athletes ultimately receive the support and treatment they needed. From this consensus statement, IOC Working Group on Mental Health developed 2 screening tools. These have been commissioned to help assess and manage issues in elite athletes beyond their careers and during and throughout their careers. Based on the research data that was gathered, these screening tools can be used for both athletes that are actively participating as well as for retired athletes. This is a picture of the document and it is accessible. I will share some information with the group after the presentation. So the IOC Sports Mental Health Recognition Tool, the SMART 1, is developed for athletes, coaches, family members, all other members of the athlete's entourage to facilitate early detection of mental health symptoms in athletes to promote help seeking for those in need. The SMART 1 presents a list of experiences that can be indicative of mental health problems. The athlete or anyone in their lives can engage with or seek support if these experiences are present significant, and persistent. Firstly, we examine common experiences, thought, low self-esteem, decreased ability to focus, memory problems, concentration, pessimism. We look at feelings, irritability, mood swings, sadness, extreme disappointment. We look at actions such as aggression, withdrawal from others, being more quiet than usual, an unexpected drop in performance. Yes, there might be some physical changes, some signs, low energy, poor sleep pattern, evidence of substance abuse, increased alcohol use or misuse. Sometimes you might look at the athlete, you might notice bloodshot eyes, right? You might notice if they are abusing substance, say for instance, marijuana or alcohol, you might be able to smell this on the athlete. You might notice that they have slow coordination or the general drop in performance. Something isn't right. So these are signs that you can look for and identify as a non-mental health professional. Of course, there are red flags that we have to be able to identify. And these include comments relating to harming oneself, talking about feeling hopeless and depressed, which is a term that some people use loosely, but depression is a disorder that has to be addressed. Dramatic weight loss or weight change. So it can either be overeating or undereating. You look for those signs. Highly uncharacteristic behaviors and emotions. We are out there as family members, coaches, persons, general persons in the entourage. If we are interacting with our athletes, we know or we can pick up when something isn't right. So these are signs that we have to look for and be able to identify. So what do we do when these mental health symptoms occur? In some cases, we have to seek help immediately, or an immediate action might be needed. But first, we want to listen to our athletes. We have to try to remain non-judgmental. We have to be understanding and empathetic. We have to give the athlete a chance to tell his or her story. We, of course, have to know what support is available and where we can find the support. We can consult with the athlete's medical team. Yes, speak with them. And of course, we go about getting help for that athlete. We have to encourage mental health literacy amongst our athletes, coaches, teams, the entire entourage, the entire federation needs to be literate when it comes on to mental health literacy. So, what is it that the SMHRT1 presents? So it gives us an insight that there is something wrong or something that isn't right or something that is disturbing or affecting our athlete's life. And we want to engage with and help them seek support to help to handle or manage whatever it is that might be bothering them. So again, we go through The second tool is called the Sports Mental Health Assessment Tool 1, or the SMAT-1. This was developed to identify elite athletes at risk for or already experiencing mental health symptoms to facilitate timely referral for those who need adequate support. Who uses the SMAT-1? Now, the SMAT-1 was designed or developed specifically for the sports medicine physician or other licensed registered health professionals. And when I say health professionals, I'm speaking about mental health professionals. Yes? So if you are a physiotherapist or an athletic trainer, licensed athletic trainer, sports psychologist working with a medical team led by a sports physician, you might be able to administer the SMAT-1 after first consulting with your sports medicine physician. It is a 3-step approach, and it can either be completed on paper or online or in a face-to-face setting. Consists of 4 different forms. There's a medical form 1, which is used by the sports physician, medicine physician, to collect data, to do an intake. Then there are 3 forms that have to be completed by the athlete. There is a form 1, which is 1 page, a form 2, which consists of 3 pages, and a form 3 that consists of 3 pages. So it's a clinical assessment, as I said before, and this has to be conducted by sports medicine physicians. In step 1, or the triage phase, the Athlete Psychological Strain Questionnaire, APSQ, is used to assess sports-related psychological distress. There's a defined threshold, there is a scoring system, and just for information, if your score on the form 1 is negative or below the threshold, then no further action is needed. If the threshold value is surpassed, then the athlete is then directed to step 2. Step 2, or athlete form 2, is an extensive screen, and it consists of 6 psychological or screening assessment tools. There is the PHQ-9, which is the Patient Health Questionnaire, and that assesses the presence and severity of depressive symptoms. There is the GAD-7, or the General Anxiety Disorder 7, that screens for the presence and severity of symptoms of anxiety. There is the ASSQ, Athlete Psychological Strain Questionnaire. And this is to detect clinically significant sleep disturbance and daytime dysfunction, right? There is a new version of the ASSQ that is included in the SMAT-1, and it categorizes sleep problems, non-mild, moderate, severe, and there's a scoring to that. Then there is the Audit C, Alcohol Use Disorder Identification Test Consumption Tool. And this identifies individuals who are engaged in hazardous drinking problems or patterns, or they have active alcohol disorders. And again, there is a scoring system, values, 5 answer question, and the values are scored accordingly. Then there is the CAGE aid, cutting down annoyance by criticism guilty feeling, and eye openers adapted to include drugs. And this is used to assess for alcohol use disorder. The beta Q questionnaire assesses, of course, the presence of eating disorder. And this questionnaire is the brief eating disorder in athletes questionnaire. In step 3, this is the athlete form 3 for 3A. If the total value in screening step 2 is below the score, then you go on to step 3A. So in step 3A, only a brief intervention is required, and you keep monitoring the athlete with form 1. And brief intervention might just be talk therapy or sending them for some mindfulness intervention or relaxation, depending on what their stressor might be. For step B, if one or more of the values are positive or higher, what you want to do is that the sports medicine physician would conduct a clinical assessment, tailor a management or treatment plan. They might refer the athlete to a psychologist or a clinical psychiatrist for further evaluation and treatment. And if additional information is needed to help formulate a clinical assessment, then they use this form to determine where they're going to go with helping the athlete. There are red flags in the SMAT 1 as well. And in the screening or the form 2, I have circled question number 9. If there are thoughts that the athlete thinks that he or she would be better off dead, or thinking of hurting someone in any way, you have to take immediate action to ensure the safety of the athlete. Yes? So this isn't something that you'd continue with talk therapy or send for mindfulness. You have to refer them to that psychologist or psychiatrist, or alert some mental health professional that action needs to be taken. In the screen 9, there's also red flags that need immediate attention. And this questionnaire looks at violent and non-violent abuse or stresses. They look at traumatic events, serious illnesses, physical or sexual assault, environmental factors that might stress the athlete. And screen 9 is one of these screens that you want to pay attention to and how the athlete responds. And depending on the response, you need to seek immediate attention for that athlete to help them to cope. A lot of mental health issues are now being made public, or the awareness is happening in the media. Athletes are speaking out, doctors are speaking out, parents are speaking out, federations are speaking out, and we want to or need to, yes, still increase mental health literacy. These tools are only the first edition. So it came out in 2019, of course, with the pandemic, the consensus committee, the mental health consensus working group, did not get a chance to meet in 2021. So there has been no review. So this is the first edition of the tools. Yes, more research is needed. As we said before, or Tony mentioned before, gathering information on this issue is really delicate, and especially in sports, we are not finding a whole lot of research. Yes, in general public health, then they have papers associated with the disorders and symptoms that we are seeing. But in sport, the research is limited now. So we need to be screening to help identify these issues. It's a very delicate situation, private situation. Yes, the stigma is attached, but screening is important. The timing of screening is important. These tools are something that we want to introduce or have in every pre-participation evaluation. We want to use these screens whenever an athlete gets injured. We want to use these screens when athletes are exiting from participation, or exiting from sports. We want to use these tools for, as I said before, retired athletes. How are they coping, not competing now? What is happening? Tony had mentioned the disorders, the gambling disorders, the misuse of substance disorders, ADHD, eating disorders. So these are tools that we can use to really help our athletes throughout their career and even after. We have to create that environment that supports mental wellness and mental help seeking. Take home message: we have to speak up. We need to report mental health symptoms, early identification, early intervention, and early offer of help is what we need, right? It's not a sign of weakness, but a sign of strength when we speak out, when we are able to say, this is happening, I need help, I cannot manage it alone. Persons are there to help. We have the human resources. So as persons involved in sports medicine, you need to get that directory. You need to get familiar or become familiar with the persons that we have available. It's not just when athletes are going out with teams or on teams that they should have access to a sports psychologist or a sports psychiatrist. It begins with each and every one of us in sports medicine saying or asking, how are you doing? How are you doing? How are you feeling? And be willing to listen to what our athletes are telling us. This is my bibliography. Thank you all for listening. I can make available the Smart One tool to any participant who wishes to have access, or sports medicine physicians. The tools are available at the British Journal of Sports Medicine. You can search and you can find the tools to have it in your toolkit. Thank you all for listening.
All right, thank you, Mrs. Brown, for that very enlightening presentation. I'm sure we're all going to be able to apply that some way in our practice. I'm going to go ahead and open the floor for questions. We'll be doing the same procedure. You can either raise your hands or post your questions to the chat. All right. I am already seeing a question in the chat from Terrian Brown. And Terrian is asking, is there a specific training, basic or certification course that medical professionals need to administer the SMART-1, or is it easy to access and can be done or calculated, and then they can decide how to proceed?
As I said before, the SMART-1 is designed or was developed for use by the sports medicine physician or other licensed mental health professionals. It can be accessed, as I said before, on the IOC website, as well as the British BMSJ, the Sports Medicine Journal. As it relates to training, the IOC has 2 courses in mental health. It's the Certificate in Mental Health in Elite Sports that's open to registered physiotherapists, licensed athletic trainers, and I guess mental health nurses. Then the diploma in mental health in sports, in elite sports, is open to sports medicine physicians. So those 2 courses I know are available through the IOC. So there's a certificate for allied health professionals and diploma for sports medicine physicians. Anyone can administer the SMART-1, the SMHRT. So anyone within the sports entourage can administer that tool.
Okay, thank you, Mrs. Brown. All right, I see Patricia Thompson has her hand raised. Do you have a question for us?
Yes, I raised it for the last presentation towards the end, but the 2 things seem connected. I noticed when Ms. Tony Brown spoke, she mentioned eating disorders, and the value seemed a little high to me. And she said that they are less than from non-athletes. And it seemed a little high to me, even for the general population of young people, from what I know of the little local data we have here in Jamaica. And I wondered if she had a breakout of the type of eating disorder. Because usually when we hear eating disorder, we tend to think of the extreme abnormal eating, anorexia and bulimia and addictive eating. But in my exposure with people generally in Jamaica and a little with athletes, disordered eating, which is usually the first stage of those extreme conditions, that might manifest as the poor appetite changes that Pierre just spoke about. She mentioned it as part of the screening tool called the Beta-Q. And I would love to see how they go about that, because in fact, in the reading on disordered eating, one of the first expressions of disordered eating is persons talking about healthy and unhealthy foods. And although this might seem very simple to us, because this is how in the media we hear it all the time. This is healthy and this is not healthy, and even with the Heart Foundation's campaign, it gives the impression that there are healthy foods and unhealthy foods that the children in school need to avoid. And this is my experience with the athletes. They are forever avoiding certain things and eating. So it means that their diet becomes very limited. And they say that if the diet for healthy eating is expensive, which is not really so relative to prices in terms of in the rest of the society. So I don't know if Karen has that kind of experience using the tool where she could speak to the extent of disordered eating that manifests or seem to manifest as poor appetite, when it's really just people being paranoid about food.
Right. So Miss Thompson, what we do know is that disordered eating actually in athletes is relatively higher than in the general population. That's
Okay, I
based
thought you
on
said less.
It
Okay.
it's higher, and this is coming out of a study from Miss Dr. Mountjoy in Canada. There are some papers that she did concerning red S, and it actually shows that it is higher in
No, that would be disordered eating as opposed to the eating disorders, which is a general term.
There is a breakdown in the consensus statement. I don't quite remember the figures, but that is an overview, and they found that the reasons were sometimes associated with low self-esteem, how if they're in a weight sensitive sport. So athletes in boxing, athletes in gymnastics, athletes in judo and wrestling, if they are in weight sensitive sports, then they tend to find an increase or a higher prevalence amongst these athletes in terms of disordered eating, and could possibly lead to eating disorders. They also had I think one of the points was secondary to dissatisfaction with body image, which led to disordered eating and eating disorders. So you will have those athletes who don't want to look muscular, bulk up, and some athletes who want to. So it's a combination of those issues that came out in Dr. Mountjoy's paper that led to those figures that Tonian would have picked up in the consensus statement and the IOC mental health toolbook as it relates to disorders. I don't know if that answers your question, but that is—
Yes, to a certain extent. In other words, what you're saying, it was more related to their perception of their body image as opposed to misperceptions about food.
With that, but they did collect data and found that the rates or the prevalence in athletes, it's higher than the general population.
Right, right. It will be good to look at it in Jamaica, because in Jamaica, what I find is misperceptions about our local foods.
Okay.
Yes.
To the type of food that they're eating, what it will do to their body. Yes.
So they restrict the eating of certain types of food.
We are putting it out there, and we need persons to jump in and do local research then, and get some data for Jamaica or the Caribbean.
Right, indeed.
Yes.
Okay.
I see another hand, or Miss Moderator.
Hi, that might be me.
Yes, that's you, Mr. Thomas.
Yes, okay. I just want to make just a quick point first. I mentioned Dr. Olivia Rose earlier as a sports psychologist. I'm also going to acknowledge the presence of Mr. Nicholas Powell, who's a sports psychology consultant, who's, I think, on the call. And I don't know if so. That's 3 mental health professionals that I know of here so far. If there are others, please feel free to identify yourself so we know, the persons who are here. So there's that. And then I just have one question to Ms. Thompson. You mentioned something a while ago in your question, but you mentioned the Heart Foundation's campaign. Are you saying that you have an issue with the campaign, that whole thing with the, I figure you're referring to the whole thing with the octagonal warning labels on the foods and stuff like that. Is that what you're referring to? And do you have an issue with that? Or what's your issue?
Yes, to the extent that it implies not to eat certain foods,
Right.
And as I recall, way back when in the 80s, that approach was labeled as not appropriate anymore. Because especially with youngsters, with children in school, what they needed was a wide variety of food so that they can get especially iron, which is a deficiency problem in Jamaica, still a public health problem, and now even emerging calcium deficiency. So the more you have them not eating this and not eating that, you run the risk of deficiencies in the diet.
Right, sorry about that. All right, okay, Ms. Simpson. All right, so, but then how then do we get the, especially young athletes, to emphasize the food they need to emphasize, and then, I guess, reduce the ones that, I guess, we'd not try to say, okay, these are bad foods, but want to have them eat less. And I don't want to make this into a nutrition discussion, but how do we approach that? What do you say?
Well, in a lecture, for example, that we had with Professor Errol Morrison and the private sector, Errol Morrison suggested what we need to do is to probably rate foods. So, for example, if you're taking sugar, you rate them because, for example, maybe athletes, might benefit, more from the sugar-containing drinks than a sedentary child who is obese. I remember doing a study of the Nutribon, and the Nutribon, for example, was very ideal for athletes, especially as a pre-training, pre-game nourishment. So to have them ban that from schools just because some sedentary obese children happen to be eating more sugar, you have to look at that carefully. So we can rate foods so persons can see which one is more appropriate, as Errol Morrison said, more appropriate from them. There was, just to give you one example, there's a bread that came out on the market about lowering sugar by 30% in the bread. But if you look at the quantitative label a little closer, you will see that they replaced the little bit of sugar that they removed, which wasn't necessary, by other types of carbohydrates and protein that then raise the calories to the same size bread to 180 as opposed to 130. So the very obese children that you're trying to spare, you're actually making them fatter. All right. By putting those labels on the food.
Ms. Thompson et al., please bear in mind that most of the data that we are presenting relates to athletes 16 years and over, elite athletes, so professional and collegiate athletes. Most of the data that we are presenting relates to 16 and over and in those categories. Okay. So professional, collegiate athletes, the consensus statement also gathered information from retired athletes. So that's the data that we are presenting and not necessarily on the younger athletes.
Well, that includes the high school athletes, and I've looked at some who are grossly underweight due to irregular fasting, especially girls.
Well, as we said, there are different things that trigger these disorders. So we have to stay alert, be aware, and be sensitive, and use the tools in gathering information.
Sorry, can I just make a quick point? I do know we have some coaches on the call. I gather we might actually have 1 or 2 young athletes as well. So some of this might be flying over the head, I'm sure. But I guess it's just for us to just acknowledge the fact that we have athletes tuning in and coaches as well, tuning into this discussion on mental health in athletes. So I think that's a good thing. Anyway, Dr. Smart, back to you.
All right, thank you. Okay, so any other questions? Or can we go ahead and move on?
Yeah.
I think so. So at this time, hold on. So we have a comment from Mr. Denzel Williams. These highlight the critical role physiotherapists have been playing, continues to play, and will continue to play in the future life of athletes and all athlete support. Hence the need for greater physiotherapy involvement in the MOH and JASM likewise, athlete entities, policies, etc. Okay, thank you, Mr. Williams, for that comment. Akisha Lee Byfield also commented eating disorders may also be based on affordability. All right, we have no further questions, so we're going to go ahead. Sure. Oh, I see John Campbell has his hand raised.
Yeah, all right, I'll be brief because again, it was kind of bitten into by Pierre. But all along the way, you can glean from what we're saying here that there is indeed a paucity of data, a paucity of research right across the board. And this is not typical of sport now, but about just about every other facet of our society. I guess I'm saying here that as a professional association, JASM or whatever other association, it's apparent that there's a need for greater vigilance in regards to the gathering of data. What are we doing to ensure that come next year when we have another session like this, we are still saying that we don't have enough data. We don't have useful data to not only to advise and inform treatment, but sometimes even to advise on policy. So I'm just putting out the challenge. I'm not fully aware that JASM has begun, for instance, the task of accumulating data more specifically within the like at boys, champs and the various track meets that they attend to. But again, I'm throwing it out there to the coaches and just all the professional bodies. What is it that we ought to be doing? Can we do to ensure that we accumulate data along the way for ourselves? And all jurisdictions are different. What is happening in England might be the same in terms of how we perceive and digest things here. So again, I'm throwing it out. What should we be doing? What can we do? What we ought to be doing? Thank you.
Okay, thank you for that. All right, any further comments? No.
Yes, I'm seeing Mr. Nicholas Paul just reiterating the point that we need more local data. So that's a consistent point being made here. More local data needed.
And the JASM is trying to lead the way, so we'll continue to pave the way. We will make sure we are including these in our pre-participation evaluations.
Excellent point.
We're called upon when we are utilized by coaches in high school, when we are utilized by coaches of the various professional clubs. These resources are available, personnel are available, and at times the JASM feels underutilized and under-consulted. I don't know if that is the word, but we are here. We are here to help. We are here to get the process going. Thank you.
Amen. Thank you for that point, especially, Piran.
Okay, so at this time, we're gonna have a 15-minute mental health break. And Mr. Jerry Benswick, I hope I'm saying that correctly, Jerry Benswick, who is the chairman for the Jamaica Rugby Football Union, is gonna speak to us briefly. Mr. Benswick.
Afternoon all. Are you hearing me well? Can everyone hear me?
Yes, we are. They're loud and clear.
Brilliant. Yes. So I am the chairman for Jamaica Rugby Football Union. And funnily enough, you would find me doing a presentation, which is called a 15-minute mental health break in my capacity. So I'm going to take a minute or two to tell you how I would end up being in this position, speaking on mental health in such a esteemed catalog of individuals. And while I'm doing that, I need you to type in the chat, what do you think a mental health break is, or a mental break is. Tell me what you think a mental break is. That's what I want to hear. Not a Google search response. If you are a professional and you have a professional response, please throw it in the chat real quick. I would prefer your opinion. What is a mental break? So tell me that while I give you an explanation how I would end up in this 15-minute break. I'm an actor and I'm a director, and I've worked for over 10 years as a drama therapist with mental patients at the University Hospital of the West Indies, worked directly with Professor Wendell Abel in interventions and workshops to do with mental health. So I would definitely suit this very lovely presentation, I must add. And I can say, Ms. Thompson, I like you. That's off the bat. Ms. Thompson have me cheering in the background going, yes, talk about the things with Ms. Thompson. Because what we have to know that is mental health and the diet, it's affected. It correlates. There's no way to talk about your mental health without talking about eating disorders. So it's right up there in the right answer. So when she jumped on it, I was like, oh yeah, that's that right. Yeah, talk about it. So text in the chat real quick. Let me see what your responses are. What's a mental break? So I've given you how I would end up in here, the short version. There's a lot more to it, but I've worked in drama and I use drama therapy in mental health. So let's see what some of these responses are. Being overcome briefly by a situation. Mental break, rest in the mind, no stress, break, relax in the spirit. Distraction from your current or usual task, something fun and participatory, giving the mind time to relax and unwind, taking time away from work, a good nap, relaxing from the task at hand, relaxing the mind, taking time to give the mind a break, focusing on something fun, yes. All right, yeah, being overcome, mental break is time taken. Self-care, all right, yeah, time out and relaxing. Yes, to all the responses, every single one, including the one that says being overcome briefly by a situation. Because in essence, a rugby game is a mental break. So. Yep, I will not elaborate. If we talk rugby, that's a whole different story, and I'll be on this call, take it over, and nobody can say nothing else. So I want to attack this from the point of view of a break versus a mental break. Now, a mental break could definitely be a break in the consciousness and the mind. You're affected by something like this incident or experience, and it causes you to lose yourself, and you have a mental episode of varying proportions. And if you were to check the scale on mental illness and read about all the symptoms, you'll find that when you read it, you're diagnosing yourself and see that you have 50% to 70% of all the diagnoses that you're reading. It's very unhealthy to read the diagnosis for mental health. Very, very unhealthy, disturbing, because I've read it and realized that I am completely mad based on all the symptoms. And everybody else who read it tell me the same thing. Don't read it. If you're reading it, just read it for work purposes and don't apply yourself to it, because everything you read, you see yourself. But yeah, I mean that, but me not sleep at night time. I mean, we get next easy and all these things. So what in sports, what we are lacking, and especially in our environment, is several things. We're talking about creating data for studying mental health in Jamaica and the Caribbean, and we lack the data to have the studies and all these things. But before we even start to look at the data and the studies, we have to talk about we have to talk about the language, the dialect, the words. Do we have mental intelligence? Are we mentally aware? And do we have the vocabulary? The vocabulary is the one I want you to focus on for the moment. We don't have the vocabulary. In Jamaica, if you ask somebody, how are you feeling? What is their general response? They feel away. Isn't that it? Me not feel good. Me not know. It's general. It's usually a general, broad-based answer. How are you doing today? Yeah, I do. There's no actual vocabulary words that we use. When you ask an American how they're feeling, I'm sad, I'm upset, I'm not feeling kosher today. And they'll give you a vocabulary of words, of emotions that they're feeling. We are not very connected to our emotions based on our society and our upbringing and just how things have progressed. And it's not our fault. We have to develop that vocabulary. And once we do, then we can speak to our athletes. Because if you ask an athlete right now how they're feeling, they're not going to be able to tell you. They're just going to look in and give a blank stare and say, hey, just feel away, And how does that help you to help them? You're saying you want athletes to speak about how they're feeling so you can assess them and do all these things. You're going to have to use the tools to get. That's why the tools are so important. You use the tools to get the information. That's how far you have to go, when it would have been so much easier if we had the vocabulary. So let's talk about the mental break. You're training an athlete. You're working with athletes. You're doing physiotherapy or whatever intervention with athletes to help them be their best selves, perform at their highest. But you're realizing that they're not pushing past their limits. They're not giving you this and not giving that. Maybe they need a mental break. And a mental break is probably not even them need a mental break. It's probably you who needs a mental break. So how do you get a mental break? You have to, I would suggest, I'm not saying you have to, I'm saying I'm suggesting that a mental break can be just like what I've written in the responses. Complete separation from what you normally do and do something completely different that has nothing to do with your sport. Now, mind you, you're trying a very delicate surface now, because if you tell any sports person to take a break from sports, why it's like telling salt to come out of the sea. It's virtually impossible. You can't tell a physiotherapist to take their mind off of physiotherapy. Because even while them take for themselves from physiotherapy and go and relax, all them think about is the next job and who them did a fix before and why this patient now respond to the treatment and why they're not following the instructions. Their mind still depends on it. Worse, the athlete who is constantly trying to be a better athlete. Them can't think about nothing else. Them girlfriend that talk to them and not even hear nothing. They must say yes, sure. But all them think about is the last race them run, how much training them have to do, and how much money they need to buy food to put on them body to get themselves fit and strong. What about an athletic fan? Somebody who follow track, somebody who follow football. You ever go to a bar or a barber shop and listen to a fan talk about Chelsea versus another side? No, two Chelsea fans are talking about them team. And when you hear the conversation, you don't think they're two different teams they talk about because they might cuss each other, War are going inside the place, and the amount of tension and stress that they might go through to talk about this indecision what was made and the stupidness of this player go out with, and him left the club long time. And you're like, are the same people that talk about? What's this? And it's so much stress that goes into it because we're so invested in sports. Sports is life, it's entertainment, it's exciting. It takes so much out of you mentally that we don't realize the physical strain it puts on us. We don't. And as a drama therapist, that's where using drama comes in. I'm able to use drama to guide our process with regular mentally ill people to help them express themselves and take out of them positive things. This now applies in sports. You have to take a mental break from the sport. One of the things you can do, because we're so competitive and we're sports-minded, you can switch the sport on an athlete. It's an easier fix than to tell them, we're going to beach and we're not going to play sports. You can actually take another sport that they don't compete in, don't know nothing about, and introduce it to them, like chess. You know what I mean? Them weird something there. And they would look at you like, no, sir. But the truth is that if you have to sit down and simply focus on moving a piece and getting it somewhere on the board to accomplish a task, your mind becomes so engaged in this process that for the time being, you're just gone. Or take them somewhere quiet, to a river, and tell them, say, hey, guess what we're doing today? We're going to train at the river. And you trick them. You carry them go to the river for train. And they expect to see cone put out and hurdles and this and that put out. And you say to them, everybody that swimsuit, like a swim. And you start swim. And everybody swim, and then some food come out, and then some music a play or something. And then they come to say, coach, we're not trained. And you say, of course we're trained. Go enjoy yourself. And what happened, and how do you measure that though? Because the truth is, you might take them on this trip or take them away from the situation and take them to a movie. Let's watch a movie. And watch a movie would have nothing to do with sports and competitiveness, but it's a love show and people talking about people and all this way. How do you measure whether that helps your athlete or not. That's the process that you have to now work with for yourself. Because what you have to look at is, how was my athlete performing before the break? And how do they perform after the break? How do they relate to me before the break? And how do they relate to me after the break? Or to each other? In a team setting, we do this bonding exercises for teams, like giving them games and team building exercises and all that stuff, which is great for them. But then, after you've done all that for your athletes, what do you do for yourself? You are professionals who work in this environment, and you're constantly gathering data, constantly looking for information and ways to help your athletes. What are you doing about yourself? When was the last time you took a break from all this work and just got chill? I mean, Mr. Chill, I mean, no have nothing to do with work. Before now ring, nobody now bother you. You just there somewhere where you and yourself and whosoever else you want to be with is having a good time when I have nothing to do with work. And it's not expensive, because if it's expensive, then what's going to happen is that you're going to stress about work to pay for it. It has to be affordable or something free, like church outing, where you just have to carry some food and some drinks. And I mean, something simple, something nurturing, something that could be just you, for you, like do your nails. Even if it not it costs you, but just, you know, something that make you feel good. Tonight you're gonna play some music and you're gonna lie down in your bed and you're not gonna check your phone till tomorrow morning. It could be as simple as that. A break is needed. We need a break because we have COVID, we have stress, we have gas price, food price. Jamaica is a stressful place, beautiful place, but full of stress. Gunman run up and down wild. We are stressed. Man them on the road are harassed too, man them can't catch a break because them just like the girl them are going away. The man them under stress, the women under stress. All of them under stress in so many ways. So how do we encourage a mental break for our athletes and for ourselves? So I want you to think about these things. I've just given you food for thought. I've not given you a formula. I've not given you something that you must do. I'm just making suggestions for you to think about it. And when we're looking at collating data and we're talking about enhancing athletes and having better mental health for our athletes, we can't ignore our own mental health, because if you're not mentally healthy, then how can you help someone else? Or aware of your mental health, how can you help someone else? So I want you to think about those things and think about, when do you get the break? When do you take the break? When do you give the break? All right. And that would be about 15 minutes, I think, of my mental break. And if I should, excellent point. I can read things. All right. I'm not going to do any reading. I'm going to read on quietly, and I will let our moderator take back over. So,
Thank
Smart.
you, Mr. Beswick. You have been causing our chat to blow up with certain discussions on how persons express themselves when they're asked how they're doing. Thank you for that. Do we have any questions for Mr. Beswick or any comments from the audience? No. All right. So
Well, sorry, I have one question.
Thank you.
Yes.
Go ahead.
So, yes, Mr. Beswick. So my question to you, you mentioned rugby, of course.
Yes.
How do our typical Jamaican rugby players, what is their mental break apart from the alcohol? what is their mental break and stuff?
So first of all, the alcohol. Yes, that's what you mentioned. Because beer and rugby is almost like one word.
This I've come to realize.
After a game, we cheer each other. And it's the thing about the sport, it's kind of indigenous to rugby, where we're brutal to each other on the pitch. Mash up one another and rough and all these things. But nonetheless, it's safe because we play within the parameters of the laws. But after the game, it is important that we have a social gathering and exchange and have a beer together. And the same guy who he and I were fisticuffs up and carrying on like wild animals on the pitch, we have a drink together, laugh and talk, and it's buried, it's done, it's over. And we don't carry any of that energy forward. You'll never go to a rugby tournament or a match and see fans fighting. Never. They never cuss over each other's teams because that's just the life of the sport. So how do rugby players take a break? They do stupid stuff. They will go to a rugby training and play football and play volleyball and just do things that don't correlate to the sport whatsoever and are totally invested in it. And then when coach said training time, then vex, we're training, all right. And you see how that affects them. It creates a bond and they play better rugby. And coaches do some of those exercises on purpose. They come to training with rugby ball and everything and put it down. And everybody ready for training now, fully dressed and training, put in 100%. And just bring up a tennis ball and throw the ball to them. I make them figure out what to do. And they figure it out. I even tell them start fling the ball off at each other and start playing stocky. All kind of things start happening. Or I might just bring nothing. I just make them sit down there and chat. And then they chat. And nobody disturbs them. And that is a mental break because they take themselves away from the game and they just talk about life and each other and what's happening with each other. And that was training. And that's a mental break. So it's about us figuring out, being creative and understanding ourselves, thinking, what would I like? And then introduce it and see if it works. If it doesn't, then you ask a question. Ask our athletes, what would you like to do today? Do we ever ask our athletes that? What would you like to do today? And hear what they say, because the truth is, we think we know what is best for our athletes. And I certainly think I know what's best for my athletes. I will tell them every day, if you follow what I said, you can't lose. But the minute you ask them a question, what do you think you should do in this situation? When they start throwing suggestions, that's it. You have to kind of really reel back and start taking notes because you're like, I never thought of none of this. This is crazy. And then you have to restructure what you're doing to suit them. They're young, they're different, they're millennials, their minds are so different. Most of us grew up back in the Stone Ages when you had to make a phone call to somebody and then go somewhere and wait to see if they're going to turn up. Not these kids. They'll check your phone to see if you're even on your way. So you can't trick them. So what's the point? Might as well ask them a question. I hope that answers it.
Thank you very much. Thank you.
All right.
Mrs. Brown, do you have something you'd like to share?
I just want to add that it just took me back to being amongst our very own Usain Bolt. I mean, how he relaxes before competition or how he relaxes in training. I mean, he was always about games and pranks and hurdling and jumping and tweaking somebody's hair or ears, you know, just for mental break. And that was his mental break. Other persons are music and playing music very loudly, or the type of music, you know, or we as Black people dancing, put on a tune and your foot and your head and your hand, everything starts moving, you know. So those are some other ideas of mental breaks that we can take. Even our athletes, a lot of them use music, you know. At training, you'll hear them or see them with their headphones, etc. But it's all good and it's, you know, empowering and enriching to the brain. Yeah?
Yeah.
Indeed. I'm looking at some questions, some comments in the chat, and I see a question I would love to answer. In this experience with Dr. Abel, which mental break exercise left the greatest mark? When I was working with Dr. Abel, I would do the activities in the presentation, a lot of the activities. And one of the ones that I've used a lot is giving, well, it depends on the room and how the situation is, but I tend to have people stand up in a room and try to, well, there's so many, but so many times I try to make them scream. I would literally make them stand up and tell them to just scream.
You could do that right now.
Yeah, we could. Half the room cannot scream. You'd be surprised to know how many people cannot scream with people looking at them. They're self-conscious. And the second one is, I have an exercise which I perform with all my athletes when I get a chance. It's a eye contact exercise where you have to stare in someone's eyes and do activities while doing it. And 90% of individuals, regular people, athletes, anybody I ask to do it, no matter what level they are at, children, adults, in between, old people, it is extremely difficult for them to stand up in a spot and stare in someone else's eyes. It's discomforting, it's hard, you make them do weird things, them look away, them all over the place. And those are the ones that stand out for me and how effective they are once they get over the hurdles. So that stands that question.
Thank you.
You're welcome.
Thanks for that. Okay, so I'm gonna go ahead and hand over to Ms. Stevens, Ashley. She's gonna go ahead and introduce our next speaker. Ashley, are you with us?
Hi, yes, I am. Thank you, Dr. Smart. All right, so Dr. Jason Hamilton is a licensed clinical psychologist and the president and CEO of Elite Sports Psychology, LLC. Dr. Hamilton holds a PhD in clinical psychology, a master's in psychology and guidance counseling, as well as a Bachelor of Science in psychology. Dr. Hamilton is a licensed member of the Jamaica Board of Clinical Psychologists and currently is the only member licensed to practice sports psychology. He is a former dean in the College of Medicine at Florida State University and campus dean of a private university. He has done extensive work with several of Jamaica's elite athletes, including work with the West Indies men's senior team, Harborview Premier League football team, Jamaica College football team, and in 2021, he was the first Jamaican licensed clinical sports psychologist to be a part of the sports medical team for the Olympics. Dr. Hamilton is also based in Miami, where he specializes in the peak performance of athletes, entertainers, sport franchises, and organizations. In the past 10 years, Dr. Hamilton has worked in the areas of academia and research. He was the director of research of the McNair program at Florida State University and the associate dean in the College of Medicine at that same university. In the United States, Dr. Hamilton worked for many years with several school teams and was the performance coach for an NCAA State University team. He recently assisted a soccer team to dominate their division for 7 consecutive years. In fact, the manager of the team commented that the team never won the championship in any year that Dr. Hamilton was not involved with them. So with that said, please help me give a warm welcome to Dr. Hamilton.
All right, Ashley, thank you very much. Can you help me with the share screen thing now? Can I know we all understand so good?
Yes, sir. Let's see.
All right, here we go. Yeah. Is my screen shared?
No, not seeing anything just yet.
Oh, sorry. I said, yeah, there you go. Yeah. All right, we need the full screen. View as. Okay. First of all, thank you, everyone. I really enjoyed a while ago, Jerry Beswick, that the vibe, what you're talking about with rugby is true, the bonding. I am particularly enjoying this entire, can everyone hear me?
Yes, sir, we're here.
Yes, we can.
I am really enjoying this presentation a lot. I want to commend Terry-Ann and Pierre-Ann. I want to thank Pierre-Ann for all her help and all the younger members of the JASM who have helped me. I don't really want to throw up my age too much, but I turned 60. My independence baby, so I turned 60 May 28th, and a lot of the young people have been helping me. As a matter of fact, I did this presentation much because Dr. Diallo Brown and others made me think that there'll be a lot of students that would be tuning in on the YouTube. So I wanted this presentation to address 4 aspects of how we learn: visually, kinesthetic, audio, and orally. The kinesthetic would be maybe if there are 3 people that raise their hands quickly, they might have money in their hands in the way that Dr. Diallo Brown will be paying their dues for the next 5 years. That's a joke. I would be paying the dues for the next 5 years for them. I don't make Diallo do it if they can get the question right. All right, Diallo. So,
looking for raise hands.
Yeah, without further ado, let me get into what we're going to be discussing today. Managing mental health emergencies in athletes. I'm going to address some of the psychopharmacology. I will address dysfunctional teams and functional teams. I will, Piran and Terry address much of what's in the IOC. I will touch on the IOC Safeguarding Officer in Sports Certificate. I know I only have 20 minutes. I did the presentation in such a way that young people viewing it might be interested in going into this field, which is growing right now. Naomi Osaka, Simone Biles, and many athletes are showing you the need for the sports psychologist. So keeping pace with managing mental health in emergencies in athletes. So I did this presentation for the Miami Dolphins and for the Seattle Seahawks. First slide, this gentleman here, Dr. Stephen Peters, would be considered one of the top sports psychologists in the world. I'm going to make a video part explain this more. Dr. Peters was first given Sir Christopher Hoy. He got a gold medal and won the Tour de France. Next year, they gave him 4 athletes. All 4 of those athletes got gold in the London Olympics. The year after that, he was hired by Liverpool. If you follow the Premier League, Liverpool almost won in 2013 with him as a sports psychologist. Sports psychologists may be most valuable for their ability to alleviate the stress of many athletes, many of whom feel enormous pressure to perform and succeed, especially at professional levels. I know we have sports psychologists on the call or on the program this evening, so I'm very happy with that. In order to be licensed, you have to have a PhD in clinical psychology and then licensed by a governing body. Financial benefits. There can be financial benefits to a team and an organization and a sporting conference for use of the sports psychologists. Sports psychologists are not just to deal with clinical or mental issues. Sports psychologists can also help the athletes perform on the day they need to perform, the way they need to perform, whereby they are managing a particular area of the brain, which is called the limbic cortical region. There can be trauma to the brain. Constant hitting of the prefrontal cortex or the front of the brain can result in anger. And many of the NFL players, as you can see, have domestic violence issues. Junior Seau committed suicide, shot himself in the chest, asked people to cut off his head and examine what was going on in there. There are neurological issues, concussions. Injured players help rookies and players about to retire. Pirian spoke about the retirement and moving on in a sport. Athletes, they say, have 2 deaths. There's their the death of their career, where they're no longer playing, and then there's their later demise. Individual concessions and team sessions within the confines of the Dolphins or the Seattle Seahawks. The concept of introducing an athlete to themselves in the future. Many athletes in retirement say, if I knew then what I know now, I would have been a better athlete. So what we do at Elite Sports Psychology, which is my private practice, we do Neuropsyc Evaluations on athletes with colleagues at Yale University. We get like a 60-page report on the athlete, and we're able to help the athlete understand how it is that they're going to manage and perform on the day they need to perform, the way they need to perform. That's the legend that they were talking about early on, Dr. Usain St. Leo Bolt. Dr. Bolt And many of the Jamaican athletes, they get it, that having fun and taking a mental break, like Jerry Bez spoke about, taking a mental break just before, taking a mental break just before performance can really, really help. You see it when you see Usain and the antics. Not to say he's not serious. And whenever you see Shelly-Ann or any of them, Elaine, Sharika, all them smile, I write about it all the time. If you see 4 Jamaican women in a race with you and you see them smiling, about to put it on you. Michael Jordan also and Shaquille also commented on this. That the difference between a good athlete and a great athlete is mental. Okay, so here is the part. If anyone can, the first 3 people to have their hand up and can tell me what is the #1 sport, the biggest sport, the largest sport in the world, if you get it correct, I will pay your JASM dues for the next 5 years. So Diallo or any other moderators, if you can just tell me who are the first 3 people, and then I will check their answer.
It was a hands up. Hands must be put up, right? You need hands?
Yeah, you must have a hand up and them give you an answer. So it is the biggest sport or most participants in this sport on planet Earth. All right, so we have a whole heap of hand up in the year.
Yeah, I think Dr. Carver's hand was up first.
All
Dr.
right,
Smart, I don't think you called Dr. Smart. Sorry, Hush.
All right, whoever it is with a hand up, just make them tell me their answer.
All right, Rochelle, Dr. Carver.
I think it's football.
All right, good. Like that answer. Wrong. Sorry about that. Next answer.
All right, next person.
It's Aaron Lottie.
Yes, Aaron Lottie, go ahead.
All right, Aaron, what's your answer? Aaron, what's your answer?
Basketball.
All right, good try. Wrong. All right, one last. Next person is one answer. If them don't get it, then we save that money. So the next, who is the next one?
Akeisha Lee Byfield.
Akeisha Lee Byfield. Okay, Akeisha Lee Byfield.
Better talk fast.
Come, Akeisha. You can type it in, you know.
Oh, you can. Oh, but I thought you said only hands because people have been
I
typing
mean,
from
she have her hand up, but if she look like she cannot mute the mic.
Okay.
Akeisha, tell me your answer so we can move on. Come only have 20 minutes.
Oh, she said she can't unmute. Go ahead, Akeisha. Try again.
Tell her to type it then. She was the third one.
Akeisha, type your answer. That's not meeting. She says swimming.
Okay, good. Thank you, Akeisha. That's wrong. So I'm going to now show you the largest sport on planet Earth.
Is that golf, is it?
All right, watch it.
Cricket.
Watch. Oh, please don't. Why are you taking so long, buffering? Oh, no.
Press play.
Thank you.
I'll be patient.
Thank you very much for that help. It's called esports.
Esports.
Video sports. 1.4 billion people are playing video games. If you play Candy Crush or any of them things, or any, you're a part of this world. NCAA have teams now. This is where the league that's sold out in minutes at $240 ticket. I presented at a conference there in 2014. 4 boys from Korea won $13 million. So in Sweden is one of the head office. We have a head office in Miami, in Dusseldorf, and then Korea is big. It's very big in Korea.
Wow. How is it recognized as a sport? That might be the question.
So
how do I?
Sports is a sport. there is a growing market for it, and you can, hold a second.
If I may, good afternoon.
All right, okay. Yeah, now go. All right.
Dr.
Yes, sorry.
Brown, yeah, man, if I may, Dr. Brown, a lot of persons may not be physically able and athletic like some, so they have moved to the games with the basic setup for the same sport that they use controls. So for the COVID-19 pandemic, this has significantly grown, and the markets, you know, they have remunerations, competitions, etc. I was just helping Dr. Brown, Sir Hamilton.
Yeah, but no problem.
I appreciate that. Yes, sorry. I know people would say that video game is not a sport, but chess is a sport, and they are now viewing it. They now have scholarships. So remember, just go on with this thing. I only have 20. I'm going to use a thing that my younger brother, who is at sixth form at JC, he found this of me on Sports Max, and it addresses some of the emergencies and the psychological emergencies.
Volume.
Hamilton, is there any way to turn it up a bit?
I don't know how. Oh, hold on.
Well, that is Max. Can you turn it up on your laptop?
Yeah, I'm trying.
You should have done that from the share screen. There's an advanced button, so you won't get it up now.
Can I go? Where would I go now?
You'd have to leave and come back in, and then there's an advanced button that will let you play volume as well.
Well, there is volume. It's very low though.
I would have checked this early.
Dr. Hamilton that day with this mobile technology. You have to have a young person when you do the presentation.
Yeah, I checked it earlier with them.
Where can we find this video?
No problem. Just walk us through what is being done. Just walk us through.
All right, I can find this video on. Oi. So everyone is not hearing this properly.
No, it's very low.
Is there anybody, young people, can tell me how to turn this up out?
So, I'm seeing a suggestion that perhaps you can share the link to the video, and maybe Francis can watch the video
right.
at another time.
Yeah.
Yeah, man. Thanks a lot. Sorry about that. But as Denzel suggested, maybe you can just kind of summarize for us what he spoke about.
Okay, I will. I will. I'll just say it then. I will go over what was being said. And there I'm addressing. So the question was about a particular cricketer, and before this they were talking about racism in sports, and the four pictures of the monkeys, 4 different color monkeys, and that whole thing in Syria A. And I was saying that I don't understand what the powers that be were thinking to use 4 monkeys in that example for FIFA, because there are athletes that experience mental emergencies, mental trauma, where fruit and bananas are being thrown at them. And the limbic cortical region, which is a region of your brain that you want to manage in order to perform well. This area of your brain is there to protect you, but at other times it can also be warning you of danger that's not really a danger. You know, like you go into a presentation and it's telling you that everybody in the class going to laugh after you, which is not necessarily true, you know? So in this presentation, I went through some emergencies that all of you have spoken about so far. The fact that the sporting community is taking the issue of sports psychology just as important as the physical injuries to athletes. I'm honored to have had the opportunity. Let me just go to the next slide and deal with the dysfunctions of a team. 5 dysfunctions of a team. Teammates are not home to each other about their mistakes. There's fear of conflict. Team is unable to engage in unfiltered and passionate debate, resorted to veiled discussion and guarded comments. Because of lack of debate, team members really buy in and commit to decisions, and though they feign agreement in team meetings. There's avoidance of accountability. Hold on a second. There's inattention to results. Failure to hold one another accountable leads to inattention to results, where individuals put their needs, ego, soccer, career development, or recognition above that of the team. So the 5 behaviors of a functional team: they trust one another, they engage in unfiltered conflict around ideas, they commit to decisions and plans of actions, they hold one another accountable for delivering against those plans, and they focus on achievement of collective results. If you can't hear this now, it's okay, I'm going to read. This says Tokyo. I'm honored to have had the opportunity to work with the Jamaica Olympic team in Tokyo and more recently with the sports medical team at the Carifta and national trials. I'm happy to see the direction of the JASM as they recognize the importance of mental performance as issues in athletics. The focus has been on the physical well-being of athletes, but the mental pain that comes with defeat and mental emergencies, injury and competition anxiety, to name a few, are equally as important. There have been a lot of competitions of late: champs, Carifta games, national trials, pen relays, world championships coming up, upcoming Commonwealth Games, the 2024 Paralympics and Olympics. These athletes can get physically and mentally more vital with each competition. So I look forward to working with them as I continue to work with the members of the Entourage. With the continued support of the JASM and its affiliates, we can surround the athletes with the assistance they need physically and mentally. It is estimated that approximately 13% of the global population experience some form of mental health disorder. Indeed, mental health disorders are one of the leading causes of functional impairment worldwide, causing the highest disease burden. While evidence consistently demonstrates the elite physical activity is associated with improvement in physical and mental wellness, studies nonetheless show that just 1 in 3 athletes may experience mental health symptoms. Despite their unique sporting talents, athletes are not immune to mental health challenges, such as the fear of failure, burnout, distress, anxiety, depression, unhealthy, as we were speaking earlier, eating patterns, insomnia, alcohol, and drug misuse. Many different factors can impact athletes' mental wellness, injury performance, pressure dealing with failure, and success. And career transition out of sports are all associated with mental health symptoms. This, in addition, is the life-challenging experience outside of sports, such as grief relationships, conflicts, and financial difficulties. Roles and responsibilities outline the role of the psychological supportive athletic environment. These stakeholder groups the Entourage members should foster psychological, safe athletic environment. Athletes feel secure in making interpersonal risks within sports ecosystems and feel accepted as an integral part of the sports ecosystem and feel respected by the sports ecosystem. The athlete's entourage, as was explained by Piran, the athlete's entourage plays an enormous role in reducing the stigma around the discussions of mental health. Particular attention should also be paid to the deconstructing cultural and gender-based taboos and misconceptions. Entourage members should work with athletes to better understand the stresses they face in their lives. Example, competitive stress, personal stress, organizational stress, to help develop healthy coping strategies. Mental health should have the same level of significance as physical health. Mental health screening should be included as routine part of physical health screening and be actively encouraged, as again was stated by Karen with regard to the SMAT. Entourage members, again, must know how to respond to an athlete in distress and learn how to help them to determine the best course of action. Entourage members should know the referral pathways, as again was indicated by parent, available if they have the concerns about the athlete's mental health. Positive discussions around these pathways can reduce barriers to help seeking. It is advised that the Entourage members are familiar with the IOC Sports Mental Health Recognition Tool.
Super Doc, can you go back to the slideshow? Can you go to the slideshow again? It's kind of small what you're showing.
Okay, sorry.
All right, thank you.
Yeah, I'm coming. Okay, so in sports mental health, a recent survey of sports medicine physicians found that 80% of the time athletes come to treatment for injury. They also discuss psychological issues. As was pointed out in Perrin again, 33.6% anxiety and depression, 49% sleep-related. And as she's pointed out, the entourage, which the entire group with the athlete, their physician, their physical therapist, sports psychologist, all of them working towards the athlete being in the best frame of mind to perform on the day they need to perform the way they need to perform. In sports, mental health is overlooked. It is essential to acknowledge that an elite athlete's mental health needs are as important as their physical health needs. Both contribute to optimizing the athlete's overall well-being and performance in excellence. An athlete's mental health needs are as important as the physical needs. The able coach attempts to instill confidence and inner peace, courage, ethics, initiative, discipline, concentration, and sound respect for nutrition. As Ms. Thompson was talking about with nutrition in that great point she was making. Yes, we need to do much more research, but anyone with eyes can see that Jamaica has been on the right path with regard to nutrition. As if you were at the Carifta Games, it looked like our athletes are eating well, and some other athletes from some other small island are not eating as well as us. So nutrition, whoever is doing the work on nutrition is doing a great job. In a ratio, an athlete's mental needs are as important as their physical needs, which I have stressed already. Okay, psychological first aid. Psychological first aid. You don't have to be, similar to what Pierre was saying earlier, you don't have to be a professional to be able to just have empathy and care. Humane, supportive, and practical assistance to fellow human beings who recently suffered exposure to serious injury, stressor, psychological emergency. You should not be intrusive. It's practical care and support. You're assessing the needs and concerns. You're helping people to address basic needs. You're listening, but you're not pressuring people to talk. You're comforting people and you're helping them to feel calm. Helping people connect to information, services, and social support, protecting people from further harm. What psychological first aids are not. It is not something only professionals can do. It is not professional counseling. It is not psychological debriefing. It is not asking people to analyze what is happening or put time and events in order. Psychological first aid involves being available to listen to people's stories. It's not pressuring to people to tell you their feelings or reactions to an event. An athlete's mental needs, as I said, are as important as the physical needs. In the sporting culture, psychological illness should be accepted as readily as bodily injury, and the same recovery and return to sport process should apply. This clinical psychologist / sports psychologist is pleased to report that coming from Miami to volunteer in his homeland of Jamaica, each time he has worked with the JASM and the other governing bodies, the collaboration and cooperation has been great, and each time it has improved. This past nationals, the doctors were calling for me. The doctors were calling, the coaches were calling. Matter of fact, I have to go to Mobe next week to see a coach and an athlete. So I know I've probably gone over my time. I did this presentation for students who might be interested in coming into this field. It is a great field. As was pointed out by our presenters before, we need more research. I'm very honored to be here. I'm very honored to be a part of this organization and presenting here today. And at this time, I will take any of your questions. Thank you.
Thank you so much, Dr. Hamilton. Your presentation was definitely quite insightful.
I apologize for the the problems with the volume. I tried to do it so young people, and I got young people. It's my brother, he's in sixth form at JC, but I guess should have tried the volume more.
Oh, that's
Again, I
all right.
apologize.
We really appreciate that. All right, so I see Nicholas Powell has his hand raised.
Good afternoon. Thank you guys for allowing me to speak. Doc, really appreciate your presentation. One of the things that you stressed on, which I really want to emphasize, is the importance of not just the physical and the medical aspect, where we see teams bringing in physical therapists, massage therapists, and have been ignoring the sports psychology, the mental side, which the mental side, in my opinion, and when you talk to a lot of people, you will see that it's, you'll notice that this part is being ignored, yet it's the major part, because it don't matter how well prepared an athlete is. If they're not mentally prepared, if they go into the competition and feel that they're not mentally prepared, then they're going to underperform most of the time. So I was pleased to see that you were included in the Olympics as a member of the Olympic Committee last year in Tokyo, as conversation with Dr. Rose, Olivia Rose, and we have been working hard. So to see that they're making steps to include sports psychology is very important. It's also important, one of the things I want to stress before I step down, is when we bring teams together, a lot of time we put teams together and we don't have team building activities, but we ask these athletes to perform at the highest level as a unit, but we don't create synergy. And that is one of the things that as sports psychologists, mental performance coaches, that we emphasize, because it don't matter how great the athletes perform individually, when they're required to perform on the level of in a group setting, if they don't have synergy, then we are going to underperform. We see where our girls are now in Mexico to compete for a major competition, and they don't have a mental coach. We see it with our male team, where the mental side is not supported. So I'm definitely want to commend you again for getting the opportunity to work with our athletes and to continue pushing the fight. Just wanted to share that. Thank you.
Nicholas, thank you so much. And as a fellow Jamaica College alumni, I appreciate and Dr. Olivia Rose are all as much as they can get in what you're saying, Nicholas, and they have more of it, because your point is absolutely correct. You can't bring a group of international athletes together, throw them together because they're talented and say, you guys play. The reason why Dominican Republic looks so well against Jamaica under 20 is that the Dominican Republic athletes play together. Them have a sports psychologist, them do the group sessions, them have synergy. The ability to move, where earlier in the presentation where I talk about dysfunctional team. You can take a team with not that many talented players and beat a talented team because you have synergy, like you're talking about, Nicholas Powell, you know? So I really, I want that. I am not the first and last. I hope that many, many more young people get into this field, and that Jamaica and our organization start to see the importance of, it's not just the physical, but the mental aspect of an athlete that is important. Thank you for the question.
Indeed. Mrs. Brown?
Hi, I just wanted to ask for the mental health professionals in the group. Anybody can take the question. Can you explain for participants the difference between a sports psychologist and a sports psychiatrist. Are sports psychologists able to prescribe, or they just do the psychotherapy, talk therapy, mindfulness? Or is it that psychiatrists are able to prescribe, or both are able to prescribe, and touch on the probably medication management of disorders?
All right. So sports psychiatrists would be able to administer psychotropic medication. A sports psychologist has to be licensed as a clinical psychologist. You can have sports with master's degrees, and there's sports counselors and therapists. The medication would be by sports psychiatrists prescribing medication. The sports psychologist with a PhD would be the one that does the neuropsych or psychological evaluations. Master's degrees can do that as well, and they can also do the counseling. So the sports psychiatrist is the one that would do the medicine.
Thank you.
Thank you. All right, so we have a question in the chat from Marlando. It says, the work of sports psychologists starts before an actual competition. How effective can a sports psychologist be when they are only engaged for a particular games, example, Olympics or Commonwealth Games, which is only for 1 to 2 weeks? Some athletes participating only on day one of events. How effective can a sports psychologist be in such a short time? Dr. Hamilton.
Okay, sports psychologists can be more effective the longer we are working with the athlete. That's not to say you cannot be effective with an athlete in the short term or help an athlete in the short term to get through a psychological emergency. That region of the brain I spoke about, the limbic cortical region, some people it's stronger, some people it's not as strong, but it is in everyone, and it's trying to warn you of danger, you know? And sometimes the danger it's warning you of is not real, right? And you can experience a whole host of psychological symptoms, anxiety, depression. So yes, to go to the question about helping an athlete in the short term, sports psychologists can help an athlete in the short term. They can definitely help even more the longer they're working with the athlete, because it's helping the athlete understand themselves, their mind, how the mind really operates. If you spend as much time training, I'll give you an example. An athlete that has become great has spent a great deal of time training his mind. So if you have a psychologist who can help that athlete who's young, maybe under 25, if they're under 25 and they're male, their prefrontal cortex is not fully developed. If they're under 21 and female, not fully developed. So they still have young thoughts. That same athlete 20 years later will look back and say, had I known this then, I'd have done it differently. Our job sometime as a sports psychologist is introducing them to themselves in the future, helping them to understand some of the things. So many, many great athletes understand that aspect of training their mind and training their discipline and being disciplined.
Okay, thank you. Thank you, Dr. Hamilton. So in the interest of time, we are going to move on to the next speaker, Dr. Julianne Simpson. And if we have enough time at the end, we can take the further questions. So I'm going to hand over to Dr. Smart, who will introduce Dr. Simpson.
All right. Thanks for sticking with us thus far, everyone. We're almost at the end, so hang in there. Our next speaker is coming to us with a short but spicy presentation. Dr. Julianne Simpson. She will be presenting a 9-step to creating a mental health emergency action plan for athletes. Dr. Simpson has a 10-year career as a physical therapist. She received her education from the University of the West Indies, Mona, where she got a bachelor's in physical therapy in 2016, followed by a postgraduate degree, her doctor of physical therapy in 2020 from Nova Southeastern University. She has certifications in multiple areas of physical therapy, including a level 2 immediate care in rugby, lymphedema and wound care, and functional integrated dry needling. She has provided coverage for several senior sports teams, including Jamaica's women rugby and basketball teams. Her experience has also brought her across the Caribbean as physical therapist to the Anguilla national football team and Trinidad and Tobago's Central Football Club. Dr. Simpson is a member of the Jamaica Association of Sports Medicine, where she serves on the education committee. She was also the treasurer for the Jamaica Physiotherapy Association for the past 6 years. When she's not busy impacting the lives of her athletes, she enjoys traveling, checking out the latest restaurants with her friends, and reading. Ladies and gentlemen, please give a warm welcome to Dr. Julianne Simpson as she comes onto our screens. Welcome, Dr. Simpson. You're still muted.
Hi, good evening. Thank you for that introduction, Dr. Smart. I will be very brief. Let me just start this here. Everyone seeing the screen? Well, yes. Okay. So let me again thank the Central Chapter for having me do this presentation. Again, it will be short, and it is by no means me creating an actual emergency plan, but it is a mental health resource. So it is a guide for us to create the plan, right? So first we're going to look at, what is a mental health action plan, the organization's role, 9 best practices to developing the organizational mental health plan, and the mental health emergency action plan. So what is a mental health action plan? What is an action plan in general? It's something that we create in the event something might happen and not, waiting until something happens to put something in place. So we are creating an action plan for mental health emergencies or mental health scenarios, in the event that it may occur. So an action plan clearly defines the approach that an individual or an organization intends to take to uphold the principles to which it has committed. So in this case, a mental health action plan will help your organization or organization to translate commitments made into tangible actions promoting and protecting athletes' mental health. It will help you to set out key activities and or initiatives that our organization can implement in order to prioritize mental health and support best practices. And this is a statement from the International Olympic Committee. Now, okay. Who is responsible for creating this mental health action plan? So a part of our sporting organizational role, and these are just a few of the roles that they have, facilitating the creation of psychologically safe environments for all stakeholders, and is the mainstay for any sporting organizational role as it relates to mental health. We also, as an organization, would like to focus on creating a positive culture surrounding mental health, which extends to the local community and not just, within the organization. Creating mental health policies and organization action plan is a part of the sporting organization's role, as well as developing a mental health emergency action plan to support athletes in mental health emergency. So now we're going to look at the mainstay, which is placing mental health as a priority. So we can all agree that being in competitive sports, athletes are prone to developing mental health issues, just based on the nature of competition, and there are different reasons for it, whether it be injury or performance, things like that can, put them more at risk for developing these mental health conditions or episodes. So as an organization, we need to place mental health as priority, and how we do this, or how we set this in motion, is to create formally written documents such as our medical code or code of conduct, which would include the promotion and protection of mental health and requirements to minimize injury and psychological harm to the athletes. Now, an example of this, the IOC Olympic Movement Medical Code from 2016, Article 2.11, they stated in their code, conditions and environments of training and competition must be conducive to the physical and psychological well-being of an athlete. So once it is in your code of conduct, it is something that is expected to be carried out as a part of the organization in the event of anything. So once we put anything formally in writing, then we are more likely to follow through with this as it relates to planning. All right. So we're going to talk about the best practices to developing mental health plan. So number one, as we said, is ensuring mental health and well-being is set as priority, which we just spoke about. Number two, developing organizational campaigns to raise awareness of mental health and the role of sport in protecting and promoting mental health, mental and physical well-being. So in this case, I'm going to use an example where, because I'm a part of Jamaica Rugby, in rugby, we have a program called Mindset. Well, it's an actual course, educational piece that you can go on, and it gives you information about mental health, emergencies, and conditions. So World Rugby created this platform through their player welfare program to allow medical professions and athletes to be aware of these things. So their organization created that awareness through their platform of player welfare, right? Number three, developing coach, athletes, and other stakeholder educational programs and tools, also tied into the organizational campaigns. Another thing would be campaigning in the community, making more persons aware of the mental health, so exercise and its benefits on mental health conditions, things like that, to bring about more awareness of the mental health and its role in the sport. Number four, developing and implementing key mental health policies, such as an emergency mental health action plan. And that is one of the biggest things that we need, especially here, because I am yet to see one or being introduced to one, being a part of, many or different sporting organizations. And number five, identifying champions of mental health, including athletes, entourage, members, leadership, and community champions to tackle stigma and improve recognition. So we want, so of course, our Jamaican culture is one of, you know, you don't want to tell people certain things because they might be in your business, so you prefer keep it to yourself, and or that you're afraid that they might judge you and tell you that you're crazy, even if they're afraid to go and speak to medical professionals because of this stigma. So we would, you know, as a part of using these best practices, we would want to encourage persons who have had mental health conditions to, you know, speak up about their journey and things like that. Number 6, building formal and informal external support networks, including referral pathways, links to community organizations, schools, and mental health services. So with this one, we are, you know, incorporating everybody in the community. So not just at the organization executive level, but we want to incorporate every aspect. So the nutritionist, the sports psychologist, the physiotherapist, because at some point we all have a role to play as it relates to managing mental health and injury. So if we have this as a best practice while developing the plan, then all areas would be covered as it relates to building support networks. Number 7, creating and implementing effective athlete safeguarding policies, procedures, and education. So we want the athlete to feel comfortable. So we want them to be able to feel safe if they are to come out and speak about any mental health condition that they might have. So once we put this in writing to say, you know, these are the policies that our association or organization has, then they will more likely be more comfortable to you know, come and speak to anybody. Number 8, developing initiatives, embracing diversity and inclusion. And I think that speaks for itself. So we want to create initiatives for anybody at all with any condition to speak out, you know, so that they can get help. And number 9, developing initiatives that build a culture of support, promote open lines of communication, and foster mental health wellness, right? So number 8 and number 9, they're tied together. All right, so what is a mental health emergency action plan, different from an organizational plan? So as I said before, the plan would outline the steps that are to be followed in the event of a situation. It is usually developed by organizations, medical team, along with licensed mental health professionals. So this is something that we can look into as it relates to creating one for our organization, because we need to ensure also that the persons who are a part of the mental health arm within the organization, they should be properly trained in order to deal with, you know, mental health emergencies, right? So we also want to create this so that we can pass it down to, you know, groups. So we might have a main club, or for example, IOC would pass it on to our Olympic committee in that sense. So once it's created, then it could be, you know, passed down to the different levels. Now, this is an outline of a basic emergency action plan, very simple, because one wasn't created for us, or we don't currently have one. I just picked up something simple. So an ordinary person, anybody, doesn't have to be a licensed person, medical person, can look at it and say, okay, these are the things that we may need to put in place for an emergency action plan. First, we want to identify clear steps and timeframes against which progress can be monitored. For example, if we have an athlete or an individual where a person could be in, you think they might be in danger, you think they might hurt themselves, or they might be a danger to other persons around them, then we want to put in place a step 1, for example. Once you've identified this, you know, maybe even using one of the tools that Mrs. Brown spoke about, then we can say, okay, we need to call for help, the ambulance. We need to call the ambulance because we don't want them to be able. So that would be like a step one. Once we have identified this, we need to call for help, call the ambulance. And then we could have a de-escalation procedure or verbal engagement. So if you know the person or you're familiar with the person, you could try to, calm them down, speak to them, keep them speaking, try to change the topic, take their mind off what's happening, just to get them to not focus on whatever the action was. Also, we want to create procedures relating to follow-up by the club, the team, or the organization. So after an episode, after, they're treated by a professional, what next? Do they just return to their clubs without any, means of following up, any means of communication? What is the plan in place? We need to create that procedure in place for our team, for our clubs, for our organization as it relates to mental health. And we also need to create a safe return to play protocol. So, how are they going to reintegrate themselves into the training sessions or going to play? Is it that they just come back to play and that's it? So some guidelines and principles need to be put in place as it relates to what steps is it that they're going to have weekly meetings or monthly meetings with their sport psychologists or, whatever the case is, and that then a report would be generated to say, okay, this person is fit to play, or he may, need to go on modified training based on whatever the assessment is, right? So I am leaving you with this question, just for thoughts, nobody needs to answer. Does your organization specifically reference the protection and promotion of mental health and well-being in its foundational guiding documents? Just something that we need to think about. I think, now I'm looking at my slide, I think I was trying to do a mental health break on the beach because I'm at the beach. So again, just this question is just for thought. So does your organization specifically reference the protection and promotion of mental health and well-being in its foundational guiding documents, right? So this is the end of my presentation. I want to thank you and I welcome any questions that you may have.
Thank you, Dr. Simpson. The floor is now open for questions. All right, I see a hand raised, Rory Alvaranga. You have a question for Dr. Simpson or a comment? Go ahead.
Yeah, hi, good evening, everyone. Hey, Doc, I made note that you said you will help organization create a mental health plan, so I'll be calling on you. Very good presentation by all. I am a swim coach here in Jamaica. I looked in the chat and I see my full team of persons here: Dr. Julianne Simpson, Dr. Diallo Brown, Dr. Olivia Rose. I see my swim people out there in the regions in the Caribbean. And, we at Kaizen Swim Club, we fully embrace a full sports medicine package. And I think there's a lot more eye-opening here today. And federations do need help because I've tried to market it to mine. And I'm not going to give up, because even our national team, which we mostly deal with youngsters, age groupers, I had 3 swimmers in here and they left. We work with younger ones and there's so much pressure on them to perform. And once they start to excel, I'm talking pressures at home, even the coaches themselves. So I really appreciate this session. Doc Diallo, thanks for the invite. Olivia Rose, everybody, I'm for big enough. Can't say I have y'all in my team already, but we'll work to improve what we have going forward. Thank you.
You're welcome, Coach.
Oh, Richard, sorry. Richard James. Oh, you introduce yourself, modest boy. I think Jamaica have it good with all that is in here. And if we really back, my hand was up from the first slide, you know, psychology, you talk about mental, a madman thing, and we need to really get people to understand this more, that it is not screening. Jody hit on it. People are gonna know my business, all these kind of things, and not just for the athlete. I'm a coach. I need help too. There was an article a few years back that 75% of Jamaica have mental health issues. We really need to look after our athletes, our coaches, and you know, just those that are all around us every day. Office is needed too.
Excuse me, Dr. Smart?
Yes.
Are you taking questions only for Dr. Simpson or for all the presenters? Dr. Smart?
We had cut short for the presenter, previous presenter. So are there any questions there for Dr. Hamilton still?
I believe, yes, Dr. Hansen.
In the chat.
Yes, there's one from Dr. Hansen there.
Dr. Hansen. Yes, Dr. Hansen had asked, and this question is to Dr. Hamilton. Could you just briefly outline the psychoactive medications we as sports medicine physicians should avoid in athletes in and out of competition?
Okay, the substances that are banned would be hormones, anabolics, EPOs, beta-2 agonists, masking agents, and diuretics. Substances prohibited in competition would include, but not limited to, stimulants, marijuana, example, narcotics, glucocorticoids, steroids.
Okay, thank you, Dr. Hamilton.
You're welcome.
I had a question for Dr. Hamilton, and I see Oriane had a question as well. All right, Oriane, I'll defer to you. You can go ahead with your question first.
Thank you, Coach Diallo. It wasn't just specifically to Dr. Hamilton, but in general, I think your honorary secretary did say to contact your association. But she said that there was going to be, you're working on getting some sort of outreach that would include having a member, one of your members being or accessible to the different associations and federations, right? But my question really was pertaining to the access to care or even screening for or age groupers, the children, right? I do realize that we did focus mostly on what would, I guess, we call the senior athletes, but the junior athletes suffer just as much, and probably in some cases even more, because they're not as mature, and so they're not able to understand the feelings they're feeling and all these things. And then it's compounded by the fact that they are supervised by their parents, who are also in denial of the fact that there is an issue. And some will say, oh, I can't afford it, and so on and so forth. So my question really was how do the school children access the facility if they cannot afford it? Because most of our student athletes come from not so well off communities and families, and they do have a need. So would it be that ISA would be the federation or association that would be referred to for them, or is there another way? What would we do?
I'm not sure if the question is generated to me, but if I can speak to this.
Go ahead, Doc.
Yeah, I have a practice in Miami, and also do a lot of work here. I have an office here. Another clinical psychologist from Jamaica College, Dr. Peter Weller, he's the one that was doing a lot of the presentation on psychological first aid. I am suggesting to Powell and Dr. Olivia Rose and to many of us clinical psychologists, I put it forward to Jamaica Psychological and Psychiatric Societies that we need to volunteer and train graduate students in the ability to give psychological first aid. So you don't have to be a licensed clinical psychologist to just be a caring human being. Because when a child is running at champs and trained very hard and then pick the start, or they went over every hurdle, about to win the race, hit the last hurdle and fall and bust up their mouth. That was not their game plan that day. That child, per stage of development, so what you do between 0 and 5 is different from 5 to 10 is different from 10 to 15 is different from 20. So her stage of development had a hard bang on it when you fall in front of everyone at the national arena or national stadium, I should say. So we need to not just, it can't just be a select few, because one, you can't handle all the amount of work, but if you can train others and you set out a certain amount of your workload to what's called pro bono work or volunteer work. Every time we're doing this work for these different things is volunteering. So we should be volunteering and training psychology students and grad students and doctoral students in the ability to give back and the ability to just administer psychological first aid. Because sometimes it don't need it's not a complete thorough examination and cognitive analysis. You just need to be a caring human being who is versed and you're not overstepping your bounds and asking for other things. You know, that's my 2 cents on that.
Thank you.
Amazon.
I'm sorry. Yes.
I was saying thank you for that.
You're welcome. You're quite welcome.
All right, so I see a few hands raised. Mrs. Brown. We're going to go Mrs. Brown and then Dr. Hanson.
Hi. I'm coming back to children athletes. I find that Jamaica is one of many countries guilty of not being mindful of what we call physical literacy. Jamaica is one of the most competitive islands in the Caribbean, and it starts from basic school, and I don't know why. We have not adopted the culture of play without being competitive, or we don't have the culture of probably supporting children athletes and encouraging them to enjoy participating in sports. So we have missed the mark on physical literacy. And what happens oftentimes is that these children, so I'm talking under 14, 15, start from very early being fiercely competitive. And it stems from the people who are nurturing them. And they absorb a whole lot of stress other than what is happening in their home environment or home space. The stress of competing, I find, or being pushed to be aggressively competitive, throws down a whole lot of issues on their head, which doesn't need to happen. Physical literacy teaches that our youngsters don't have to get into competitive mode until they're probably 14, 15, or this aggressive competitive mode. And it's across the sport. Okay, the gymnast is going to start from the 4 or 5, etc. But let it be fun. Why is there this intensity or this great intensity that I see in Jamaica? And probably, and I'm going to say Jamaica is probably one of the most intense sporting countries in the Caribbean, we just push, and more push. Why is it that our parents or coaches can't mentor, can't encourage, can't intervene as much as they can at, say, the up to the under 13, 14 level? Yes, if there's a true case where after screening they need to be put on to the psychologist or the psychiatrist or some mental health professional, then this needs to be done. Yeah, but can't we adopt or go back to the culture of nurturing the athlete? Junior athletes aren't to be trained or treated like elite or adult athletes. Are we missing the mark then with physical literacy and training and how we train? Yeah, are we listening to our younger athletes like they need to be listened to? Yeah, where are we failing there, and why the need for the intervention of a sports psychologist or psychiatrist so early? Where are we failing? Are we failing? Anybody can take it or comment on that.
Okay, I would like to take that one. First of all, I am happy for your comment. And it goes to the issue of safeguarding generally in sports, not just for junior athletes, but for all sports practitioners. And whilst the literature suggests that you're not to have children specialized so early, we have to be mindful of how we swallow all of that data in its entirety, because it is from this very same competitive, yet pressuring, yet facilitative environment that we are able to manufacture the kind of talents that we do. So there needs to be balance, and the last presenter mentioned policy in terms of mental health issues so that we can navigate these challenges in a safe way as possible. But it is not that we do not encourage or nurture a competitive spirit from early. And you asked the question, why would a sports psychologist be needed so early too? It's not necessarily because the child has mental health issues, or that could also be the case, but it is also to introduce them from a very tender age, in the same way you would with physical training, of the importance of mental health, mental preparation, resilience, coping, dealing with losses, being collaborative, the whole works. So it is from that background that we are introduced at that early stage. But what you are mentioning really speaks to the issue of safeguarding and protecting sports practitioners, especially children, that we really need to work on that as it relates to policy and development of policy in that regard. And not just policy, but implementing these policies and having strict safeguarding officers to, I don't want to use some strong words called sanction, but when people are not adhering, that they will be penalized because of how important safeguarding is.
Okay, thank you, Dr. Rose and Mrs. Brown, for that discussion. Okay, so Dr. Hanson, do you want to go ahead with your question next?
Yes, two comments. Thank you, Dr. Rose, for that comment about managing the competitiveness. It brings to mind a discussion I had with one of Jamaica's better coaches, high school coaches, who got a job in a particular jurisdiction where things that Jamaica could never dream of providing for its athletes, everything was provided for them. and he was well remunerated and really didn't have to spend very much because the government sponsored trips to Europe and all over the place for the teams to play. However, he couldn't stay in the job for very long because he found that the drive that athletes needed to have to reach world-class performances just was not there. He eventually came back to Jamaica where he knew the drive was there and it could fulfill him as a coach. Coaching young people to accomplish their very best. So there are pros and cons to the competitiveness. And I suppose we need to harness it in a safe way and channel it in the right direction. If you remember a few years ago when we had our annual conference, I made a presentation on how the Europeans, especially the British, have government policies in place to guide the coaches of young competitors about how often they can train, how often they can compete in a game, all of these things. And I still say that government has to have in place policies to protect the children who come under the purview of coaches, so that, and they actually have a mechanism in place to monitor to see to it that the coaches and the academies are managing the children the way they are supposed to. It can't just be policy on paper, but there's nothing else there to back it up. So I think government policy is very important in managing this and yet not stunting the drive and the capacity to achieve. So that's one comment. The second comment I had was directed at Dr. Hamilton to say that we may have a paucity of sports psychologists here in Jamaica, or even clinical psychologists. But I imagine there's a plethora of them as part of the diaspora out there. And we have various diaspora organizations. Would it be possible for you and your colleagues to link with people out there in the diaspora who are willing to volunteer their time, not necessarily to come to Jamaica, but to be contactable by phone when an organization or an athlete needs to speak to somebody? Thank you.
Yes, Dr. Thank you for that question, if I can answer.
Any further on that? Yes, Dr. Simpson.
Yes, trying to answer Dr. Hanson's question. I would love to address that with the diaspora. I am quite sure, like you said, sir, that there is a plethora, it's replete with many of them overseas who want to come back and help. And with the technology the way it is, you can generate a certain amount of hours out of your week where you say, I'm doing this as volunteer to help the athletes, and you're giving the various sporting organizations in Jamaica an opportunity to use the service. We are having a good presentation right now, but it took a long time for people to even understand that this aspect of an athlete's life is important. And just like what was said a while ago about the young man going to a place where there's a lot of money, but then the desire wasn't there in the athlete. You can't teach hunger, you know. Hunger is something that we have, and a hunger to be better, hunger to improve. And Jamaica, yes, we are very competitive, and yes, we need to monitor it for the youngsters, but it has also resulted in us being very good. So we need to be able to balance that. I would like to, Dr. Hanson, I can give Dr. Diallo Brown my information, Pierre and the rest of them. They already have it where I could be contacted. You could call me and we could see how we could go about getting those in the diaspora to see how we could help better. Hope that answers.
That answers my.
All right, so thank you.
Okay, last final question. I see John Campbell has his hand raised for a while now, and then we're gonna close off.
Right.
Campbell?
So where's the after party? But nonetheless, just to touch a little bit on what Pierre had mentioned about physical literacy. I just wanted to say that the Jamaica Olympic Association had indeed sponsored a program on what they call the long-term athletic development, which actually delved into physical literacy, selected personnel from, I think, rugby and tennis and all across the sporting fraternity participated in this sponsored online seminar. And it spoke a lot about physical literacy. But what came out of this was that that not all athletes will advance to the elitist level. But that some of them will, the idea was that even if you don't advance in terms of elitism, you would have acquired the passion for long-term participation in sport, which certainly would argue well for, the development of a healthier society, and so on. So I just wanted to point out that indeed the JOA had indeed done some work in the area of physical literacy. The idea was for that to mushroom and to spread and so on. I don't know what happened thereafter, but it's on the table, so to speak. Thank you.
Right. See, with Dr. Smart, I had one more quick question, if you have the time.
Dr. Diallo?
Yes.
Yes, go ahead.
Yeah, but just a quick question. So to Dr. Hamilton, and I guess Dr. Simpson kind of touched on it, in terms of the psychological first aid, and especially in light of the whole mental health action plan. Well, I guess, two parts of the question. Is there like, do you have like a template? There's something that, if I'm here with a team of athletes and I think someone's going through a mental health issue, I want to administer psychological first aid, so to speak. One, is there some kind of training I've needed to get, some kind of certification like Red Cross first aid? I don't know. And two, if I don't have that training, is there a reference, like a quick tool, some referencing that I can go through, maybe a checklist of questions to ask or things to do, something to administer that psychological first aid until I can, of course, refer to somebody, to an actual mental health professional? Is there anything like that?
Literature that you can get PDFs and download them from online.
Or Mrs. Brown, can someone?
Sorry?
I wasn't hearing the question clearly.
Okay.
I didn't hear the question clearly.
All right, I can put it again. I'm just asking for if I have a mental health, let me not say emergency, but if I want to administer psychological first aid, as Dr. Hamilton spoke to, is there a tool that I can find, like a quick reference tool, some template, something like that I can find to use? And also, is there some kind of training, some kind of certification, a first aid certification, if you will, a psychological first aid? Is there anything like that, or anything, any of those, do those exist, and where are those?
I would think that the aim is, Diallo probably, is to try and prevent or not to have a mental health emergency situation.
Ideally, yes.
It goes back to using the screening tools and actually being probably able to identify and help before it gets there. In an emergency situation, I am talking off the hat, if I am not a trained mental health professional, then I would not attempt to take command of that mental health emergency situation. So again, it speaks to having an action plan and knowing who to call or how to get help. I think, or I reflect at times on our sports med room at the stadium or the treatment rooms that we have. There is one entrance, one same exit. If somebody has, we need to have the plans and policies or action plan in place to know that if somebody has a meltdown per se or an emergency mental health situation in one of those rooms, every volunteer or mental health practitioner in that room should have a clear understanding or a clear outline of what to do or probably how to escape. Yeah? How to place yourself to get out should the situation escalate. Yeah, and that is what the mental health, that's part of the mental health emergency planning. Jody mentioned de-escalating the situation. So listening and talking and probably trying to divert the person's attention or thought process if somebody wants to take that on. But there should be, I think, an action plan or policy. Just as how we do the Heart Foundation's
the basic life support. Right.
Yeah.
Correct, yes.
Then we should have an action plan. So everybody should know if this happens, who are the persons there? Who takes it on? Who helps to de-escalate? How do we position ourselves? How do we get close to an entrance to exit if we need, or what barrier do we have between ourselves and the person having the crisis situation? That sort of thing. So this is where the action plan comes in. I don't know here in Jamaica of any certification or any course per se to take, but we know that we have mental health professionals. So it's getting an action plan in place and having policies written down or something in place to say, okay, from now on or whenever we are at X volunteering or sporting event, etc., we need to have these persons in place that can come in. That's just my thought process.
Can I add to that? Can I add to that? Well, my understanding of first aid is to, I think Dr. Hamilton said all it takes is a caring adult, and I take the point of a serious situation with the one way in, one way out. But having events with one or two persons like this, they may not be in the location where that child fell over the hurdle and how they start to react. Is it then correct to think that the first aid, right, is until we can get the better person on hand? Adding to that and asking a question at the same time, Dr. Hamilton, Diallo.
Yeah, Rory, if I can speak to that. So psychological first aid in this regard, as it was stated by Red Cross and them, it's just a caring person at the time of emergency. If it escalates, as in the case that Karen is talking about, to the point where the person might be trying to harm themselves or harm others and are getting physical with the medical or physical therapy personnel, there, as Pierre said, there should be a plan in place be it restraining of the athlete, all of that. Right now, the IOC's responsibility as a leader of the Olympic movement aim to inspire. They are coming up with a plan, and I'm currently in the process of doing the certificate coursework. It is to implement the international, and therefore you would then train others in your country. It is to implement the International Safeguarding Officer in Sport certificate. And this piggyback was a part of what Piran was speaking to. We have to have it where we are able to train people, grad students and psychology students and others in the ability to administer psychological first aid. When it gets to a situation which is more dire, then you need the qualified. And as everything that they presented today, you have where the medical personnel or the psychologists, if there are in the positive or negative, then it escalates or de-escalates. So there are for then the person to then be decided whether this is this level or that level. So we need to again be getting the training and as much of it as possible, and getting volunteers too from all over, because we have a lot of psychologists, as were said by Rory and others and Chambers, and that are out there, and Dr. Hansen, that would want to help if they just knew how their help could be of use.
Can I just add to what Dr. Hamilton was saying, please, if you don't mind?
Go ahead.
I mean, and it's a burning thing for me, as a parent of a child who has changed sports, right? My child is now 16, right? Mm-hmm. She was one of the top local gymnasts here representing the country, broken by a coach, rebuilt by her current coach, and I will have to big up Mr. Corey Alvarango, and Dr. Jody has helped her, just evening conversation, because you say it takes just a caring individual, somebody who will just speak to them, have a soft, kind word, whatever it is. I am grateful and very happy to know that this association now exists. I wish they exist. I wish I knew of them 5 years ago when the breaking down process of my child began. I mean, but you're here now, right? And so as a parent, I would extend my volunteerism as well, because there are a lot of parents and other persons who are not necessarily going to be graduates or whatever, who would be willing to have that smaller bit of knowledge that, that in the training that you would be able to provide, so that you have a larger cohort of persons who can be there, who are even just there, not necessarily be an official at an event volunteering, but they're there, right? Because I've found over time, just being in sport, that because my child has been doing sports since she loves to play sport. And if she doesn't want to do it today, it's not going to happen today, right? And that's just our agreement. So if she's not loving it, we are just not doing it. But that's not everybody. And the coaches, a lot of the coaches need this kind of psychological, they need a training, they just need the support, right? Because a lot of them are extremely young and they themselves are still children, right? So even if we can get there and we can have a situation where we are training the coaches and, opening up the capacity to the parents and so on, and just other caring persons, so that we do have a larger cohort to try and protect the kids who are going to be our superstars.
I love this question, Corinne, and as someone who's worked with many gymnasts, I can understand how difficult it must be for you as a mom watching your daughter do a backhand spring and, you know, things that no male would ever do, spinning backwards on a piece of wood. We could train our parents and our coaches. When I say psychological first aid, I'm not just saying to be putting a Band-Aid on it. And there are serious issues that young people go through in their stages of development that can be hampered or harmed by how the adults in the situation handle the situation. So yeah, if we could get to a point where we have all the organizations in sport fall underneath or get report to the Jamaica Olympic Association. If all the associations are getting trained on this psychological first aid, then I think it could be of benefit, put it that way.
Thank you. And thank you also, Coach Diallo. You are a blessing. You wouldn't believe.
You're welcome. You're welcome.
Dr. Diallo, can I squeeze one in?
One, who's that? Mr.
Jerry.
Yes,
Jerry.
Mr. Go right ahead.
All right. So we're having an amazing discussion, and as you can see, nobody wants to leave the discussion because it's so great. One of the things I want to reiterate and point out mostly is if we don't develop the vocabulary in our society, then we will continue to have trouble with mental health issues, diagnosing, figuring out, finding out. We have to be watching for signs when we could have been told what the signs are if we develop the vocabulary. And when I say the vocabulary, I mean emotional words. We don't use them. Are you angry? Are you sad? Are you upset? Are you happy? We don't use those words. And if we start to use those words and start teaching our kids to use those words to describe their feelings, to explain what they're feeling, and they understand what it means. What does this mean? What does happy mean? What does sad mean? What does angry mean? What does upset mean? What does hurt mean versus physical hurt versus emotional hurt? If we can start to use those words in our society in general, then our athletes will adapt those words and they will use them. So when we speak to them and ask them questions about how they feel or what they're going through, then maybe they'll be able to tell us without us having to go through before we even have to use a proper diagnosis. The athlete already said it. I'm feeling very sad about this whole situation. And we immediately latch on to that word and say, oh, the athlete said they're sad. So now we need to find out why they're sad and what's causing it. It might not be something that's right there in front of us, and we can dig into them right away to get it out of them. But we have to find creative ways of working into that area. So if we can get them to use those words, that will help us to determine what their mental state is, then it's making our job easier. But we have to learn the words ourselves. Everybody has to be talking like that. You know, I'm gonna feel this. That's how we talk. I'm gonna feel this. But what exactly are you not feeling? Are you angry about it? Are you upset about it? Are you sad about it? What are you feeling? So these are the things I want us to look at, that vocabulary development.
All right, Mr. Bensley, thank you very much. Dr. Smart? Oh, yeah,
Yes.
over to you.
I'm here listening to your discussions going on. All right, thank you everyone for your inputs. And I'm glad to see that we don't want to leave here. I'm gonna ask Miss Terry-Ann Brown to join us and to send us off. Hi, Terry.
Hi, good evening, everyone. This is a program that obviously go on and on, that we could go on and on about. Dr. Hansen was, I suppose, wrong at the beginning. We gained enough stuff, or enough nuggets, not little, from these professionals. I would like to take the time to thank Dr. Simpson, Julian Simpson, the Education Committee for JSM and CC JSM. Ashley, our moderator, Dr. Diallo Brown, for assisting with the technology and moderating and everything, really. Dr. Dominic Smart for moderating also. Echoing Tony's presentation, it is very important that we strengthen our understanding of mental health issues and even more so recognize that though an athlete might seem physically well and traditionally we are concerned with their physical fitness and health, mental health is a major component of their overall wellness and should not be taken for granted. I want to thank the audience. The question and answer sessions really raised a lot of food for thought, not just for us as an association, but for our country and the Caribbean, and where we need to bring athletics. Thanks to Mrs. Brown for her presentation on screening tools. I'm sure that the participants benefited and even learned a lot more. Athletes, coach, medical professionals, and anyone here on how to, on what can be done or where they can find or access tools to identify whether an athlete or anyone really may need help. The importance of mental health literacy was not missed in your presentation, so we really appreciate that, Mrs. Brown. Mr. Benswick, your mental health session provided us with the moment we needed to relax our minds from the heavy content and ease ourselves. I think something that must be noted or that we must remember is that as professionals, we need to take mental breaks and we need to pause. How can we assess and bring athletes to their best form when we ourselves are also at our worst, or when you guys are also at your worst? Dr. Hamilton, your presentation was greatly appreciated. Thank you for your time, your student-friendly slides. Technology may have failed us today, but the content, it really hit, and we were able to get insight into the management and drug indications of mental health emergencies in athletes. I believe that Dr. Simpson's presentation, more than ever, was a call for us as an organization and a country to support our athletes and set mental health as a priority for this year and the incoming year. I don't know about you, but I think this was a Sunday evening well spent. Our knowledge sharing and the facilitation of discussions is not our knowledge sharing and the facilitation of discussions among not only professionals but students, parents, coaches, it needs to continue to exist on a continuum. JSM is here, present, and is always changing and inspiring change with ideas, and so we thank you, CCJSM, for bringing us this Keeping Pace webinar, and JSM for the initiative and forums facilitated across our island. Have a good evening, everyone.
Bye.
Hi, Mr. Brown, thank you very much. Excuse me before we go, guys. I'm going to share, Dr. Hamilton's asked me to share the YouTube link for the video he's trying to play. So I'm just gonna put it out there in the chat. Hello, is everyone hear me? Please, sounds very quiet.
Yes, we're
Yes,
hearing
they
you.
are.
Oh, okay. Never mind. So
We're
it's in the
hearing you.
chat. Everyone. And before Central Branch closes, though, just want to make a quick plug for the Western Branch. They're going to be having their Keeping Pace webinar in September, and they're speaking on, well, I'm not quite sure the theme entirely, but it's on developing athletes. So I guess youth athletes will be the focus again. So look out for that. Look out for more details coming up, and that one will be in September. I believe the last weekend in September. So we'll upload the information for that as usual.
Okay.
All right. Thank you very much. That's my over to you.
All right, so we're now at the end of our Keeping Pace seminar. So thanks everyone for participating and contributing. And we hope to see you all at the next one. All right.
If I
so,
might interject, Dominique,
Sure.
please tell the participants about getting CMEs if
Oh
they
yes,
wish.
thank you for reminding me, Mrs. Brown. So we have 3 CME hours that can be allocated to this presentation. Maybe Terry can confirm for me. We will get our certificates by email, correct?
Yes, you will.
Right. Okay. So you can just look out for that email. And once you've registered for the webinar, we should have had that email saved, right, Terry?
Non-members pay
Right.
$500.
Okay.
Non-members of the JSM pay $500 for CME certificates.
Okay.
If they wish to get the CMEs.
All right. Okay, so I've noticed quite a few persons have logged off. So we may have to send out a notice to them regarding that fee.
Yes, well, it usually goes out with the notice, but we can send it out additionally as well. Yes.
Right, because I didn't see it previously.
Amen.
All right.
In fact,
so
go ahead.
there's
Part of the registration.
Right. Yes. Thank you.
Information is a part of the registration process.
That's correct. Thank you.
right, it is. Okay. All right, so enjoy the rest of your evenings, everyone.
Thank you. Bye.
Thank you. Good night, everybody. Oh, good afternoon, everybody.
Thanks everyone. Thanks to all our friends from down the Caribbean that logged on. We had St. Lucia, we had New York, we had Guyana, we had Barbados. Thank you all.
Thank you all. All right, good night, end the meeting. Thank you.
Thanks, Diallo. Bye.
You're most welcome. Bye.